Hi, Jeremy.
Hi, Nurse B.
Good to see you again.
Good to see you.
We're here for your full head-to-toe yearly physical, right?
Yeah.
Great. So I'm just going to go ahead and ask you some questions, take some notes before we get the physical assessment started. And I just want to check in to see how we're doing since last year.
I'm doing pretty well, about the same.
Same as last year? Okay.
Yeah.
Good, good. So no major issues, injuries, surgeries, accidents, anything like that?
No.
No new diagnoses I should know about?
No.
Okay, great. So just go ahead and go down from your head to your toe. I just want to check on everything, and then we'll do the physical exam. So any problems with headaches, pains in your heads, any head injuries in the last year?
No, just some slight headaches every once in a while, but
Okay.
nothing crazy.
Slight headaches. And what about with your eyes? Any changes in your vision?
Not that I've noticed.
Okay, and I have here that you do wear some glasses. Is the prescription still working for you?
Yeah, I believe so.
Perfect. So I'll just have you wear those when we do the vision assessment, okay?
Okay.
Any issues with your smell, difficulty breathing through your nose?
No.
Great. What about taste or your mouth? Any sores, any pains?
No.
Are you going to the dentist as well?
Yes.
How often do you do that?
I try to do every 6 months.
Perfect. All right, moving down, any issues with your breathing, with your chest, any pain?
No.
Great. And what about your heart? Any fluttering, any sudden feelings of faintness, lightness, anything like that?
No.
How often are you getting aerobic exercise?
Probably not as much as I should, but a couple times a week at least.
A couple times a week?
Yeah.
Like 2 times a week or more than that?
Maybe like three times a week.
Okay, yeah. Ideally, we'd be looking at 4 to 5, but 3 times a week isn't bad. Is your job sedentary, right?
Yeah.
You sit for your job. Yeah. So, better to do 3 than none. But of course, if you can get that up to 4 or 5, at least go for a walk every day. You have a dog, as I recall.
Mm-hmm.
Yeah. So get out and just stretch your legs. What about your diet? Any changes to your diet recently?
No.
Okay. Any large weight gains or losses, sudden gains or losses?
No.
Okay, good. And moving down, any issues with your stomach, pains, irregularities, anything like that?
No.
Okay. Any issues with the joints, knees, ankles, any injuries, sports injuries, anything like that?
A little bit of knee pain.
I don't need pain. Okay.
Yeah.
Both sides or just one side?
Both sides.
Okay, I'll check it out when I'm down there. Okay. And last thing, any changes with circulation or sensation loss?
Not really.
Any problems with memory, remembering things or calculating things?
No.
Great. All right, Jeremy, so you're looking pretty good compared to last year. Let's just go ahead and start the physical exam.
Good.
Just sanitizing my hands here. And let's start with the head. And let me know if there's any pain or tenderness while I check through here. Is there pain when I squeeze you at all?
No.
That doesn't cause any headaches, issues? You said you had a couple headaches.
No.
Where in your head are you feeling those headaches generally?
Usually the front.
Like here?
Mm-hmm.
Okay. I could be more sinus related, actually. Just gonna look through with a comb really quickly. Look at the scalp itself. Any tingling on your scalp when I do this?
No, not really.
Excellent. Hair looks healthy, thick, evenly distributed. You haven't noticed any hair loss, have you?
No.
Not too oily, not too dry and brittle. Perfect. Looking at the eyebrows, I'm going to press right here. Any pain when I do that?
No.
What about right here?
No.
Okay. Can you close your eyes for me? Is there tear glands here? Any issues?
Mm-mm.
And gently palpating on top of the eye. Okay. I'm going to continue to palpate. Can you open and close? Open, close. Little clicking there. Is that normal for you?
Yeah, it
You've
is.
noticed that before?
Mm-hmm.
Does that radiate pain anywhere?
No.
Okay. If that gets worse, we may want to do a little bit of TMJ work. Just going to feel for some lymph nodes. Just relax. Feeling for any swelling here. Mind if I just move this down just a little? Perfect. Can you shrug for me? Shrug your shoulders for me. Good. Then I'm down. And then up like this to like that. Yeah, perfect. Okay, relax. Maybe a couple of small swelling in the neck here. Nothing to be concerned about. Do you ever have allergies or hay fever or anything like that?
I'm a little bit of allergies.
Yeah, okay. Could also be contributing to those headaches as well. All right, let's go ahead and do a couple of cranial nerves. So if you could open your eyes for me, I'm going to just be checking the symmetry of your face. Upon inspection, looks very symmetrical, as symmetrical as any of our human faces are. Can you raise your eyebrows for me nice and tall? Okay, good. And smile for me. And then can you make a frown? And can you puff those cheeks out and just hold them for me? Don't let me push them in. Good, nice and strong. And close your eyes really tight. Scrunch them up and don't let me open them. Good. I'll do some sensation next. So it's going to be this really light cotton wisp. Give me your hand. Do you feel that? So close your eyes. I'm just going to have you say yes when I touch your face, okay?
Okay. Yes. Yes.
And did that feel same side to side?
Yes, it did.
Good.
Yes. 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 Yes.
Okay, everything felt equal and the same.
It did.
Excellent. I'm going to do the same thing with something sharp, and I just want you to tell me if it feels sharp. So just say sharp when you feel it.
Sharp. Sharp.
And that felt same sharpness?
It did. Sharp. Sharp.
Good.
Sharp. Sharp.
And just as sharp at the top as it was at the bottom?
Yes.
Awesome. Let's go ahead and look into these eyes. So before we get your glasses, I'm just going to look into the eye itself. So go ahead and look straight ahead over my shoulder for me. And I'm going to shine a light in it. It might be a little bright. I apologize. Good. Okay. Very good. Can you look up for me? And look down for me. Okay. And straight ahead again. Just checking for the reflex. Perfect. And just look right over that shoulder again. I'm going to get super close. Very good. And on the other side. Okay. All right, so do you have your glasses with you, Jeremy?
I do, yeah.
Can you just put those on? I'm going to have you do this eye chart here.
Okay.
And just go ahead and read this line right here for me.
EPTZO.
Good, and can you read the one below that?
CFDHJ.
Perfect. Can you cover one eye for me, please? And read this line backwards.
OZTPE.
Okay, cover the other eye for me. And read this line forwards.
Same line?
Mm-hmm.
E-P-T-Z-O.
Good. Can you tell me what this color is right here?
Red.
What about right here?
Green.
Good. So no issues with color then. So keep those glasses on. I'm going to have you hold this in front of one of your eyes. Good. I want you to look at me, straighten my eye. Tell me when you see my fingers wiggling.
See it wiggling?
Good.
Wiggling?
Good. Keep looking at me.
Wiggling?
Good. Go ahead, switch eyes for me.
See it. See it.
Perfect.
See it.
Okay, great. No problems there. You can move on to those ears. Just going to touch them first. Could you remove those glasses for me now? Thank you. Any pain in your ears?
No.
Okay, let me take a look. A little bit of wax buildup, but no redness. Could just be also those allergies. That side looks a little clearer actually. I'm going to do some hearing tests. I'm going to hit this fork, put it here. Tell me if you hear it on the right, the left, or both equally.
Okay. Equal.
Perfect. Same thing, I'm going to hit it, I'm going to put it here. Tell me when it stops making a sound.
Stop.
And you hear it here?
Mm-hmm.
Great. Same thing on the other side. Tell me when it goes away.
Stop. I can hear it.
Perfect. I'm just going to use this little puff of air, and I want you to close your eyes and tell me left or right side.
Left. Right. Right. Left. Left.
Very good. Same thing, left, right, or both.
Left. Both. Right.
And I'm going to whisper something behind your ear. I'm going to cover this ear and tell me what I'm saying. 1, 2, 3.
1, 2, 3.
Okay. X, Y, Z.
X, Y, Z.
Great. So no issues with your hearing. That's excellent. Move on to your nose now. Just going to gently take a look. Can you breathe in for me here? A little bit of occlusion. Breathe in for me there. It's pretty clear on that side. Is that common for you? Have a little bit of a stuffiness?
Yeah.
Okay. Does it bother you greatly?
No.
Okay. Close your eyes for me. I'm going to give you 2 scents to smell. Just tell me what they are.
Lemon?
Yep, that's perfect. And this one?
Peppermint?
Very good. Okay, so far no problems. Last thing, I just want to peek into your mouth. Can you say "ah" for me? Okay. I'm going to put on a glove. I'm just going to very gently feel inside of your mouth, okay? Any pain here?
No.
Okay. Can you push with your tongue into my hand? Good. And here? Excellent. All right, Jeremy, I'm going to move down to your chest.
Okay.
I'm going to listen to your heart to start with. can I just check your pulse here? Just relax it. And breathe normally. Okay. I want to hear you breathing as well. So just take a deep breath in for me. Same thing here, little breath. 2 more. Good, nice and clear. I'm going to go ahead and just do a little bit of tapping. Good. And can you say 99 for me?
99.
One more time.
99.
Okay, good. Can you just go ahead and twist for me and take a look at the back? And same thing, just a nice deep breath in. One more. On this side. Okay. Same thing, tapping on the back, just relax. And say 99.
99. 99.
Take a nice deep breath in for me. And let it out. Okay. Any pain here?
No.
How about here?
No.
Great. I'm going to go ahead and have you just lay back here and take a look at your stomach.
Okay.
All right, Jeremy. Taking a look at the stomach. Any issues with the stomach?
No.
Just going to press a couple of places. Tell me if there's pain. I want you to breathe in and push out all the way for me. Just going to feel for the spleen. Good. Can't feel it. Okay. Take a listen for your bowel movements. No problems there. And just checking your vein here while you're laying down. Okay. No issues. I'm going to do some range of motions with your legs while you're laying down, okay? So I want you to bend your leg up. And you said you're having a problem with that knee, right?
Mm-hmm.
Does that hurt to bend like this?
Not really.
Okay, I felt a little popping there. You feel that?
Mm-hmm.
Okay, so it might be a little bit of arthritis there. Lost a little bit of the lubricant in that knee. Try this side. Hear that crack there as well? Okay. You may want to consider some exercises that strengthen this band here along the side. It's going to help the knee really hold in place. Definitely feeling some crepitus there. A little bit of swelling as well. Feel the ankles. Any issues with that?
Just a little bit of tenderness.
A little tenderness. Can you pull them back as far as they can go? And don't let me pull them. Okay, good. And push them against my hand. Okay, good. And I'm going to move your toe up and down. I want you to tell me what's up and what's down, okay?
Okay. Up, down,
Okay, on this side.
down, down, up.
Perfect. want you to tell me if you feel the vibration.
Feel the vibration.
Tell me when it stops.
Stop.
Feel it?
Mm-hmm.
Tell me when it stops.
Stop.
Perfect. Okay. All right, Jeremy, go ahead and sit up. I'm going to just finish up with the strength and range of motion in your arms, okay?
Okay.
Jeremy, now that you're sitting up, I'm going to have you do some range of motion for me. So can you go ahead and lift your arms up like that? Any pain in the shoulders?
Just a little.
A little?
Mhm.
Okay. And can you go back like this? Okay. And how far up can you get your hands? Okay, good. I'm going to do some strength too. So put your arms up like this. Try and push me away. And try and pull me closer. Okay. And then same thing just with your hands like that. Push with your fingers. Good. And pull back. Very good. All right. Do a couple more neuro tests here. I want you to tell me if you're feeling 1 point or 2 points.
1, 2, 1,
Okay.
2, 1, 1, 2.
Good. And same hand, I'm going to draw a number facing you. And I want you to tell me what it is.
3.
Okay, and now I'm going to do a letter. Try it again.
8.
Mm-hmm. Good. And this side, same thing, starting with a number.
1.
Okay, and then a letter.
C.
Yep, perfect. You're going to move that finger up and down just like I did on your toes. Tell me up or down.
Up. Down. 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 Up. Up.
Okay, good. And just a couple of sensation things here. I've got a cold and a hot. And just tell me cold or hot when you feel it, okay?
Okay. Cold. Cold. Hot. Cold. Hot. Hot.
Good. All right, I'm just going to do reflexes and then we're done. So I'm going to start out with your arms. Go loose. Relax into my hand. Very good. Okay. And then look straight ahead and don't look down. Okay. Same thing on the other side. Okay. I know it's a little uncomfortable. Okay, look straight ahead, don't look at me. Okay. Okay. Not as much of a reflex on that side. Okay, and this is going to feel uncomfortable. Good. All right, all your reflexes are intact. So Jeremy, I think that's the end of the assessment. I'm going to go ahead and type up those notes, but this looks like you're pretty good to go, and just come back if anything specific bothers you, okay?
All right, thank you so much.
Hello, I'm Dr. B.
Hi.
Nice to meet you. Could you just state your first name for me?
Yeah, it's Kevas.
That's perfect. So Kevas, today we're going to be just doing a full head-to-toe assessment, especially with the head, neck, ears, and throat. Is there anything that's currently bothering you right now, or is it just an annual exam?
Not particularly that I'm aware of.
Okay, perfect. So we'll just do a general assessment then.
Yep.
All right. I'm going to ask you a couple of questions about your health history and just answer to the best of your ability. Have you had any headaches or pain in your head recently?
Not really.
Okay. And what about anything with your eyes? Any blurriness, double vision, any trouble reading?
Yeah, I actually get blurriness sometimes when I work a lot on my computer.
Okay.
And I get tired a lot. Yeah.
So I'll go ahead and make sure to check your eyes. There could be some dryness that you're experiencing.
Yeah.
What about with your nose? Any change in smell? Any blockages, stuffiness?
Not really. Like I have like the cold all the time,
Okay.
but it became pretty much like normal for me.
Oh, so you have some issues
Yeah.
breathing in now. All right, well, let's take a look at that for sure.
Pretty much chronic, I would say.
Chronic, okay.
Yeah.
Any changes to your taste? Any issues with your mouth, swallowing?
No, not at all.
Okay. And any issues with your skin or pain in your face?
Yeah, I actually get some troubles with acne, but I think that might be because I ate a lot of sugar lately.
Well, I'll take a look with a magnifying glass and see if I can see any, real deep blemishes. But to me, from the surface level, it looks pretty typical for, we all get blemishes here and there, All right, moving down, any issues with breathing in your chest?
I wouldn't say so.
No? Okay. And what about any pain in your back?
Yeah, I actually get lower back a lot.
Lower back? Okay.
Yeah, but then I guess I sit a lot, so that might be the cause.
And are you exercising frequently?
Yeah, I do, and that might be the problem also.
Maybe a little overuse,
Yeah.
a little strain. Okay, well, I'll have a feel to see if there's anything that feels swollen or anything like that.
Yeah.
Moving on down, any issues with your stomach, any pain, any discomfort, any nausea?
I wouldn't say so.
Okay.
Not that I can remember.
And finally, with your legs, any tiredness, any feeling of tightness in the legs?
No.
Okay, perfect. So I'm basically going to start from your head and work my way down to your toes. And if anything bothers you along the way, just let me know.
Yeah, okay.
Okay, so first thing I'm going to do is just palpate your head.
Yeah.
Any pain or tenderness here?
No.
All right. I'm going to take a look with my light here. What I'm just looking for is any blemishes on the scalp.
Yeah.
Have you been in a wooded area at all recently where you might have gotten a tick bite?
I don't think so.
Okay. Sometimes the tick bite bullseyes like to hide in the hair.
Yeah.
Okay, yeah, the hair feels good, nice and thick and evenly distributed. Not too dry or brittle. Okay, I'm just going to use this to just check the hair in a couple of places.
Yep.
I'm just looking for any infestations or lice. Any itching in the scalp?
Yeah, a little.
A little? So is based on, do you feel like it comes and goes, or is it more like a dry skin?
I think it's more like a dry skin from all the shampoos that I use.
And how often are you washing your hair?
About 2 to 3 times a week, I would say, like after 3 days.
Okay, I would maybe consider a scalp conditioner. There is just a little bit of dryness, but also not atypical this time of year. All right, that looks fine.
It might be even because I'm dyeing my hair.
Coloring your hair?
Yeah.
Okay, and do you do that yourself?
No, actually my sister does.
Okay.
She's a hairdresser.
Okay, so you have a professional doing it. So I trust their judgment to know if when your hair does not feel healthy anymore.
Yeah.
To me, it doesn't seem too brittle or there's not a lot of breakage. So
Yeah,
I think
it
you're
always
okay.
takes just 1 or 2 days after it is like colored. So
Okay.
yeah.
Well, it looks good to me. I didn't notice. So
Yeah.
good job for your sister. I'm just gonna take a light and look now in your ears. And you said no problems hearing, right?
Just a little, I would say. I sometimes struggle to hear when people are talking in like restaurants.
Okay.
Yeah, like
I'll take a look inside. Any pain when I press on here?
I wouldn't say so.
What about right here?
No.
Okay. Let me take a closer look here. I do see a little bit of buildup, but no blockages. I do see a clear line of sight to that ear. Check the other side. Again, any pain here?
Wouldn't say so.
Okay. And then here?
Nope.
And that side looks completely clear.
Okay.
No redness, no swelling.
Yeah.
I'm wondering if you're having maybe just a little bit of allergies with the stuffiness. You said it's kind of constant, right?
Yeah.
Okay. Any pain here then?
No.
What about here?
No.
And press on your tear glands. Any discomfort?
No.
Okay. Taking a look at your face. Let's take a little closer look. Look straight ahead for me, please. I think that'd be perfect. Okay. And the pores look normal. Do see a couple of blemishes, but again, not uncommon for your age. Are they painful? Do they hurt?
Only when I'm trying to squeeze them.
Ah, okay, so
But
yes.
otherwise, no.
Okay, well, I definitely recommend just putting a little bit of topical treatment on them when
Yep.
you get breakouts and trying not to squeeze because that can definitely scar the skin.
Yeah, I know. I landed the hard way.
And do you do any shaving of the baby hairs on the face or anything like that?
No.
Okay, because that can also be irritating sometimes. So it looks very good and very healthy. Just feel for temperature here. Even temperature. I'm just gonna go all the way down here.
Okay.
Do you have any issues with hot flashes or feeling cold, circulation issues?
I don't think so.
Okay. Feels good to me. I'm going to take a look into your eyes now. So first thing I'm going to do is just look straight ahead. I'm going to shine a bright light. I'm going to go right in the middle here. Good. Take a look at the tip of my pen
Okay.
and just follow it everywhere it goes. Any double vision right now?
No.
Okay, just follow it with your eyes. Any double vision throughout that?
I wouldn't say so.
Okay, perfect. I want you to look away off into the distance,
Mm-hmm.
and then I want you to look at my pen. Now back to the distance, and back to the pen, and follow it in. Great. Next thing I'm going to do is check your peripherals. So
Okay.
again, stare straight ahead,
Okay.
and I'm just going to come at you with my fingers here, and I want you to tell me when you see them wiggling.
Okay.
And just keep staring straight ahead.
Okay, now. Now.
Good.
Now.
Okay. I'm going to give you a card. I just want you to cover one of your eyes. Pick whichever one. With the card, sorry. Like that.
Yeah, oh, like this. Yeah.
I'm going to cover my eye, and I want you to do the same thing. Tell me when you see my fingers
Yeah.
wiggling.
Now.
Okay,
Now.
good.
Now.
Switch eyes for me, please.
Okay. Now.
Mm-hmm.
Now.
Good.
Now.
Perfect. While I have this, I'm going to have you just read from about 24 inches away.
Okay.
And do you use any reading aids, glasses, contacts, things like that?
Yeah, I'm actually, I don't know if it's short-sighted or not, but basically I do not see well into the distance.
Okay, so that would make you nearsighted, yes.
Yeah, nearsighted.
So can you see this right here?
Yeah, I would say so.
So I'm going to point at a couple letters, and just, can you read this line for me, starting with this letter?
C, F.
Perfect. I'm going to have you jump down to this line.
Okay, it's E, B, D, Z, O.
Okay, and cover one eye with your hand. I'm going to have you read this same line backwards. This one here.
Yeah, okay. O, Z, T, B, E.
Good. Cover the other eye. And read it forwards.
Okay, E, B, D, Z, O.
Perfect. So yeah, I would say you missed a couple in there, but very, like one. So no issues with the nearsightedness. Just check your pupil size here. And that's about a normal between 3 and 4. I've got some colors here. And check your color blindness.
Mm-hmm.
Can you tell me what color that is?
It is purple.
And what color this?
Yellow to green.
Yep. And if I put these two colors together, what do you see?
Green.
Okay. And what about this one alone?
That's blue.
Perfect. No issues with color then. Just going to look pretty deeply in your eyes now.
Yeah.
And just relax. Red reflex intact on that side. Good. I don't see any visual issues with your eyes. Maybe a little dryness on the surface. You can try some over-the-counter eye drops.
Yeah.
And see if those are helpful to you at all.
Yeah.
You said no issues with your smell, right?
No.
Okay, I'm just going to look gently up the nose. Okay. A little bit of swelling and redness in there. Can you breathe in for me? Okay, and on this side. A little more occlusion on that right side as well. And take a look into your mouth. So just open wide for me. You say ah.
Ah.
Okay, uvula rises, teeth look even. Just stick your tongue out.
Okay.
And move it side to side. Okay. I'm going to have you make some funny faces.
Okay.
So smile for me. And lift your eyebrows up. And can you hold them up there? Good. And close them really tight. And can you keep them closed? Good. Can you puff your cheeks out for me? And don't let me push them in. Excellent. So complete symmetry there as well. Not worried about any drooping or stroke-like symptoms. I wanted to do a little bit of a hearing test.
Mm-hmm.
I'm going to hit the tuning fork, put it in the middle of your head. Let me know if you hear it more left, right, or both.
Okay. I would say I probably hear it a little bit on the right side.
Okay. Let me try it one more time. Do the same thing, left, right, or both.
Mm-hmm. Again, right side.
Okay.
Like,
So,
I even feel it on the left side, but it's better on the right side.
so that's telling me there was a little bit more occlusion in this and swelling in this left ear as well. So I think that could be playing a role in some of your uneven hearing.
Yeah.
I'm going to hit this, put it in the back of your head here. Tell me when you can't hear it anymore.
Okay.
Can you hear it there?
Yeah.
Great. Same thing on the other side.
Now. Yeah.
Okay. While I have this out, I'm going to do a bit of vibration sense. So I'm going to take your hand. I want you to close your eyes and tell me if you feel pressure like this or vibration. You feel the difference?
Yeah.
Okay, tell me pressure or vibration.
Yeah.
Pressure or vibration.
Vibration.
Okay, pressure or vibration.
Vibration. Pressure.
Good. The other side, please.
Vibration. Little vibration. Pressure. Vibration.
Perfect. I want you to keep your eyes closed. I'm going to make a slight puff of air, and I want you to tell me left, right, or both.
Left. Left. Right. Left. Left. Left.
Good. Okay, so the hearing in the left ear is not too bad. It's just a little less than the right.
Yeah.
Okay. All right, I'm going to go ahead and feel some of your lymph nodes now.
Mm-hmm.
So just relax. Let me know if anything's tender. Can you shrug your shoulders for me? I'm just going to get in here. Okay. There's just a couple under here. All right, not feeling anything. Can you turn your head all the way that way, as far as it can go?
Yeah.
And don't let me pull it back.
Okay.
Keep it there. Good. And all the way this way, and don't let me pull it back. Good. Can you push your head forward, turn to the front?
Like this?
Just like
Okay.
that. And push your head forward against
Okay.
mine.
Yeah.
And pull back against me here.
Mhm.
All right. And can you shrug your shoulders against me?
Yeah.
Arms up like this.
Mhm.
Don't let me pull.
Mm-hmm.
And push me away.
Mm-hmm.
Keep your arms back like this. Push me away.
Yeah.
Can you put your hands like this?
Yeah.
And don't let me pull.
Mm-hmm.
And then put your hands up like that. And don't let me pull. No issues with strength then. That seems pretty strong. Last one, just up like this. Keep there.
Yeah.
Keep there. Good. Can you put your arms out like this?
Yeah.
And close your eyes.
Mhm.
I'm going to tap on your hands. Don't move your arms. Okay, you can open your eyes.
Mm-hmm.
I'm going to draw in your hand a letter, and I want you to tell me what that letter is.
Okay. Say.
Perfect. And now it's going to be a number.
Was 3.
Correct. Try the other side. I'm going to do another number here.
Okay, it was 1.
Okay, and when you add 3 with 1, what do you get?
4.
Okay, great. And last letter here.
C.
Perfect. I'm going to ask you a couple of logic questions.
Mm-hmm.
If you were walking along and you found a crying baby on the street, what would be the thing that you would do first?
I would, it would depend how small it is. Yeah, I would probably like count to it and ask where is their parents.
Perfect. And if I were to tell you that, if I were to say a sentence to you saying, save your money for a rainy day, what would that mean to you?
Oh, that I shouldn't spend all my money.
Perfect. All right, so logic is in place. You would make good decision making, everything like that. And can you tell me where we are right now?
We are in office.
Okay.
Doctor's office.
And what did you have for breakfast this morning?
I think it was a cookie.
A cookie?
Yeah,
Okay.
Belgian milk cookie.
Well, that's maybe not the healthiest of breakfasts.
Yeah, I do not eat it often, but
special treat.
yeah, special treat.
Well, other than the fact that that's very high in sugar, it's good that you were able to remember that. What was your favorite subject in primary school?
Everything.
You liked a lot of school, like school when you were younger.
Yeah.
Okay, so
I
you're
was a nerd.
nerd.
Yeah.
So your long-term memory is good as well. And can you tell me who the current Queen of England is? Do you know the first name?
Elizabeth.
Perfect. So you also have a good sense of history and retaining information. So I'm going to move on down to your arms now. I'm going to do some sensation touch. Actually, I'll do a little bit on your face as well.
Okay.
But I have a bit of a sharp and dull tool. So
Okay.
you feel the difference between that and that?
Yeah.
Okay, so I'm just going to press on your face in a couple of places, and then I'll move my way down your arms and just say sharp or dull.
Yeah.
Okay, close your eyes for me.
Dull.
Mm-hmm.
Sharp.
Perfect.
Sharp. Dull. Dull. Sharp. Sharp.
Just going to lift this up.
Dull.
Mm-hmm.
Dull. Sharp.
Perfect. On the other side.
Dull.
Mm-hmm.
Sharp. 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 Dull.
Great. So you're able to sense even slight variations really well, so no problem with sensation, correct?
Yeah.
And then does this feel the same on both sides?
Yeah.
And this feel the same?
Yeah.
And this?
Yeah.
Okay, so I'm not worried about any sort of neurological deficit in the sensation
Okay.
space.
Yeah.
All right, I'm going to take a listen to your heart and your lungs.
Yeah.
You can just relax and breathe normally. I'm going to get underneath here, okay?
Yep.
Okay, heart sounds good. Take a deep breath for me. One more. Okay. I'm going to put my hands on your chest. When I touch you, I want you to say 99.
99. 99. 99. 99. 99. 99.
I was just listening for some tactile frematus there. Tapping on your chest really briefly. You said no problems with feeling short of breath or anything like that?
Yeah.
Okay, good. Yeah, all sounds okay. I'm going to have you turn around. I'm going to do a quick assessment on your back, all right?
Yep.
All right, now that I have you here, I'm going to do the same thing on the back. Tell me 99.
99. 99. 99. 99.
Okay, that sounds good. Taking a listen. sounds really clear. I think that any of that trouble breathing is really coming from your nose and your sinuses. All right, I'm going to do the same thing, tapping on the back. Just hitting my own finger. Okay. I'm going to press on the spine here. Any pain?
No.
You said maybe a little bit in the low back you had issues?
Yeah.
Any pain when I do this?
No.
Okay, so it's not the kidneys. Just feeling there's definitely a lot of tightness, these muscles right here,
Yeah.
especially down here. I'm gonna move you slightly. Any pain when I twist you like that?
No.
Okay, and come the other way. Any pain there?
No.
Okay. I think you've just got some real tight muscles down here. Stretching, massage, all will help.
Yeah.
But your posture looks good overall. And there's no pain on the spine itself, right?
Mm.
And can you, I'll just use my light here. Can you feel this all the way down?
Yeah, I can.
Okay. Just looking with my light here for any swelling I might have missed. I think it looks okay. Can you bend your neck down as far as it can go? Any pain up here?
No.
Okay, there's really a lot of tightness right here.
I just feel it in my elbow.
In your elbow?
Yeah.
Which one?
Right one.
Okay, so that may mean that there's like a bit of a nerve out of alignment here, or a little pressure on the nerve that's sort of shooting down,
Yeah.
connected. So go ahead and lift your head back up. Don't want you to be uncomfortable. Just feel it. Does it hurt at all when I press like this?
No.
Okay. So what's happening is all this tension and this little bit of swelling on the neck is putting pressure on the nerve here that's shooting down your ulnar into your elbow. So again, just releasing some of that tension and that pressure is going to help with that a lot. I think maybe a massage or rolling on a foam roll or something like that. All right, go ahead and return to the front. I'm going to just finish up with your reflexes.
Okay.
All right, Kavas, let's finish up with some of these reflexes. I want to especially pay attention to that shoulder. So
Yeah.
put your arm up like this for me. Give me the weight. Go completely limp. A little bit of a reflex there.
Yeah.
Again, give me all your weight. I see just a little one there.
Yeah.
So you're not super reactive. Yeah, not have too much reaction in your reflexes. Is that typical for you?
I would say so.
Okay. Look straight ahead. Don't pay attention to me. Look straight ahead.
Yeah.
Okay, this side. Okay. You let your jaw hang for me. I'm just going to tap like that. Okay. And then just scooch back for me on the table here so your legs are dangling. Up the other way, so your legs
The
are
other way,
dangling.
yeah. Sure.
And just another one plus reflex there. Definitely don't have too much, but a slight reaction.
Yeah.
That's okay. All right. Hi, Heather. I'm Dr. B. Nice to meet you. I'm going to be doing your assessment today, okay?
Yes.
So I just want to learn a little bit about what's going on for you. So it says here in your charts that you've been having some headaches and some eye pain, correct?
Yes.
How long has that been going on?
A couple of months now.
A couple of months? And where in your face or your head is it feeling pain?
I mean, really, like on the sides here.
In the temple
and,
area?
Yeah, and then
Okay.
my eyes as well.
Behind your eyes or the eye itself?
Behind my eyes.
Okay, headache behind the eyes. And is it a sharp pain, a dull pain, a throbbing pain?
Throbbing.
Okay. Is there anything you do that makes your headaches worse?
I mean, when I'm working all day, really, like staring at the computer for sure.
Okay, makes sense. Working at a screen.
Yeah.
Do you use eye drops or anything like that? Any medication for your eyes?
No.
Okay. Any other issues today besides the headache and the eye pain?
No, that's it.
Okay, so what I want to do for you, Heather, is go ahead and do a full assessment. Just want to make sure there might be no other root causes for those headaches. We'll take a look into your eyes. We'll just do a full check, sort of head to toe of everything that's going on, and see if we can get you some relief today, okay?
Okay.
Perfect. First thing I'm going to do is put on a pair of gloves.
Okay.
And I just want to ask you a couple of questions to test your awareness of the situation. Can you tell me where we are right now?
We're at your office.
Great. And can you tell me what day of the week it is?
It's Monday.
And about what time is it right now?
I would say 4 p.m.
Great. So you're oriented to place, person, time, and situation, and you're here for what?
To talk to you about my headaches that I've been having.
Great. Perfect. You remember what you had for breakfast this morning?
Yes, I had a few eggs.
Okay. And what was your favorite subject in school, in elementary school?
English?
Great. So I just tested your recent and your long-term memory there. So everything seems to be intact. You have awareness of where you are and mental acuity, okay?
Okay.
So first thing I'm going to do is just take a look at your scalp and your head here.
Mhm.
And because you are having those headaches, you say they're right in the front here, like this, right?
Yeah.
Let me just feel around. Any of that hurt or tender?
I mean, a little, but not really.
Okay. Any tenderness in the top of your head here?
No.
Okay. What about the back?
No.
Just going to go underneath here.
Okay.
That feels okay?
Mm-hmm.
Okay. Any pressure when I press in the sinus area?
No.
And what about here?
No.
Okay. Very good. I'm going to go ahead and just do a quick scalp check, just see if there's any lumps or bumps under the surface that could be causing some pain.
Okay.
Would you mind just turning towards me a little?
Yeah.
Thank you. Your hair is nice and thick and evenly distributed. Any problem with itching on the scalp?
No.
Okay, and the other way, please.
Okay.
Thank you. Just feeling for any thinning. Feels good, nice and consistent texture all the way around. Just nice and dry. Not too oily, not too dry or brittle. Okay, very good. I'm going to move on to your face now. First thing I want to do is just look at the symmetry of your face. Can you smile for me? And frown? And can you lift your eyebrows up? And can you close your eyes really tight? Don't let me open them. Okay, relax. Can you puff your cheeks out? Can you open your eyes? And hold them. Okay, good. Good facial symmetry there. Good strength in the face. Take a look at your eyes. Can you look up for me? Okay, and look down. A little bit of redness, a little bit of irritation there. I'm going to take a closer look with my light. Stare over my shoulder here. I'm just going to shine a light in your eye. I'll try not to be too uncomfortable. Just looking for a reaction of those pupils. Good. And they do react. Go ahead and reorient yourself. You alright?
Mm-hmm.
I did see that was a bit of a reaction with the light there, a little bit more than in a normal patient, so I can tell that those eyes are irritated and dry for you. Let me look a little bit closer, actually. gonna get a little bit close here. I apologize if it's uncomfortable. I'm just gonna rest my hand. Okay. I don't see any scratches. The red reflex is there. Have you had any vision trouble lately?
No.
Okay. I'm going to have you just read a little bit of the chart here. I'm going to hold it about here. I can hold it for you, and just go ahead and read this line for me frontwards.
Yeah. E, P, T, C, and O.
Perfect. And just cover one of those eyes for me.
Okay.
Can you read this starting with that letter going the other way?
Yeah. O, C, T, P, and E.
Great. And the other eye, please. And go ahead and read that forward for me.
E, P, T, Z, and O.
Great. No issues with your vision then. Can you tell me what this color is here?
Red,
What about this color?
green.
Never had any issues with color blindness?
No, not as far as I know.
Great. I'm going to have you follow the tip of my pen.
Okay.
Just moving your eyes, not your head, so keep your head still, okay?
Mm-hmm.
And I want you to tell me if there's any double vision or straining of the eyes. Any double vision?
No.
Okay. Go ahead and look way over my shoulder, and now look at the pen. Way over my shoulder and the pen. Very good. I want you to stare straight at my nose. I'm going to move my fingers in. I want you to tell me when you can see them wiggle.
Wiggling,
Okay.
wiggling,
Great.
wiggling,
Mm-hmm.
wiggling.
Okay, so really good vision there. Go ahead. Here, you can use this here.
Okay.
Just cover up one of your eyes.
Okay.
I'll cover up the same eye. Tell me when you say, keep staring at my nose and tell me when you can see my fingers.
I can see your fingers. I can see your fingers. I can see your fingers.
Great. Switch eyes for me.
I can see your fingers.
Go ahead, keep staring at my nose.
Okay. I can see your fingers. I can see your fingers. I can see your fingers.
Okay, great. So I feel like the issue with your eyes is definitely related to dryness and the straining there, maybe some slight irritation from staring at the computer or allergies. I'm not seeing any issues with the vision itself, though. It doesn't seem to be a cornea problem or an issue with the optic nerve. All right, while I have you here, I'm going to do a little bit of sensation on you. This is a neurological test. So if you give me your hand, I'll show you that this is soft.
Mm-hmm.
And then can you feel the difference of the sharp there? Okay. I'm going to poke on your face while your eyes closed and just tell me sharp or dull.
Dull. Dull.
Does that feel similar on each side for you?
Yes.
Okay, good.
Sharp.
Hmm?
Sharp.
And does that feel the same?
Mm-hmm. Sharp. Sharp.
And it's the same there too.
Mm.
Next, I'm just going to touch you lightly on a part of your body. Keep your eyes closed and just point to where I touch you. Okay? Good. Good. Okay, good. No issues with sensing those?
No.
I'm going to go ahead and do a little test on your nose, check your nose. I want to look into it with my light. I'm going to tip your head back. No redness, no swelling. Doesn't look like, do you have any dripping, allergy, sneezing issues?
No.
Okay. Can you breathe in for me with the side? Okay, the other side. Pretty open on both sides there. Do you have any issues with your sense of smell?
Mm-mm.
Okay. I'm going to go ahead and just look into your ears now.
Okay.
And I am just looking for any signs of allergies or any other reactions anywhere else that could show me that headache and that eye strain could be from that. No issues there? Any pain or tenderness when I press on this?
Mm-mm.
All these piercings are okay?
Mm-hmm.
Okay, any pain there soon?
Mm-mm.
All right, I'm gonna look at the other side. Thank you. Same thing, no redness, not a lot of discharge or anything, no pain on your ear.
Mm-mm.
And this right here is okay?
Mm-hmm.
Did that make any itchiness in your ears when I did that?
No.
Okay, let's do some hearing tests. I'm gonna make some soft noises like this next to
Okay.
your ears, and I just want you to tell me left, right, or both.
Okay.
Close your eyes for me.
Left. Right. Both. Both. Left. Left.
Good. I've got this tuning fork here.
Okay.
So what I'm going to do is hit it, put it on your head, and I want you to tell me if you hear it right, left, or both equally.
Okay.
Close your eyes for me.
Equal?
Yep, perfect. That's exactly what you should hear. Now the next thing I'm going to do is hit this tuning fork. I'm going to place it on the back of your head here. I want you to
Okay.
tell me when it goes away, when you can't hear it anymore.
I can't hear anymore.
Can you still hear it there?
Yes.
Great. Do the same thing on the other side. Tell me when it goes away.
I can't hear it anymore. I can still hear it.
Perfect. All right. So no issues with your hearing. That all looks intact. Can you open your mouth for me and say ah? Okay. How often do you go to the dentist?
Every 6 months.
Great. No issues with your teeth?
No.
Just gonna feel for tenderness. Can you press into the side of my hand here with your tongue? Okay, and on this side. Good. Open and close your jaw for me. Any clicking? There's no clicking. I can feel any pain there.
Mm-mm.
Okay, relax. Just gonna feel for your lymph nodes. Just feeling for any lumps. Again, if you had allergies or any sort of sinus infection. Shrug your shoulders a little for me like that. Yeah, perfect. No, don't feel anything. Just gonna feel underneath here. Good. Okay. Don't feel any swelling, no tenderness. I'm pretty sure that eye strain and those headaches there are related to your vision. Either that's just staring at the screen, or perhaps you need to go see an optometrist and get tested for glasses. Do you currently wear any glasses or contacts?
No, I do not.
Okay. And do you feel like you feel particularly strained after doing a lot of reading on the computer or looking at things close?
For sure.
Okay. So it could be that you need a little bit of a prescription to help you with that in your vision. But let me just do a couple of checks of those internal organs just to make sure everything else is working functionally, okay?
Okay.
So I'm going to listen to your heart and your lungs.
Okay.
Starting out with your heart, so just go ahead and breathe normally. I'm just going to listen to all 4 quadrants. And lift this arm for me. Just going to get underneath here. Okay. Now I'm just going to listen to your lungs, so I do want you to take a deep breath when I touch you. One on this side. That sounds clear. Can you go ahead and say 99 for me?
99.
Good.
99. 99. 99.
Okay, tactile parameters is good. Would you mind swinging around for me? I'm just going to check the back side. Perfect. First, I'm just going to start by doing some tapping. Okay. Take a big breath in for me and let it out. Good. Equal expansion. Any pain or tenderness here in the kidneys?
No.
Great. Now I'm just going to listen to your breath sounds on the back. So I'm going to have my stethoscope in 4 places. I just want you to take a deep breath every time. Good. Last one. Okay, all sounds clear. Same thing when I touch your back, say 99.
99.
Okay.
99. 99. 99. 99.
Okay, and turn back towards me. All right, Heather, so all the medical tests look good. I'm just going to do a couple last neurological things just to make sure with your eyes, we always want to be sure it being in the brain area that we're not having any sort of tumor growth or anything that would worry us about a neurologically functioning issue. So can you go ahead, take your hand and alternate every finger like that. You go a little faster. Great, can I see the other hand? Okay, wonderful. And same thing, rapid alternating on your hand. Go back and forth as fast as you can. Good. Okay. I want you to touch my finger and touch your nose with your pointer finger. So touch my finger and touch your nose. Everywhere it goes, just follow my finger. Touch my finger. And back to your nose, and then touch my finger. Back to your nose. And can you do it with the other hand? Good. No issues there. And does this feel the same on both sides? This feels the same? Down the legs here?
Yeah.
Okay. Last thing I'm going to do is just measure the head for symmetry, make sure there's no swelling that I'm not sensing just by feeling. I want to make sure it's the same side to side. So just relax. I'm just going to go this around your head. I'm going to mark the midline. Okay. Okay. Just right across the eyes there. Nice and gentle. Okay, good. Just to be extra sure. Last thing we're going to do is reflexes, okay?
Okay.
So just relax. I'm going to do the ones in your arms. Just give me all your weight. Perfect. Okay. Okay. All the weight. Okay. Just let your jaw hang just a little bit. Okay. And can I have your hand? I'm going to draw something in your hand. Tell me what letter I'm drawing.
3.
And on the other side, I'm going to draw a letter. Tell me what letter.
F.
Perfect. Okay. I'm going to put something in your hand. Keep your eyes closed. Tell me what this is.
It's a pen.
Great. All right, Heather, you can open your eyes. So I'm just going to make a note that I think you should go see an optometrist. I think you should get a full eye test done, really in depth. Your vision was okay on the small chart here, but I really think you need more in-depth testing, further away, closer, different types of tests with more in depth than we can do here in the office. So I'll go ahead and write you a prescription for that. But other than that, are you feeling okay for now?
Yeah.
Okay, well, thank you so much for coming in. Hope you feel better soon. Hello, I'm Dr. B. Nice to meet you.
So nice to meet you.
Can you just confirm your first name for me, please?
It's Katharina.
Okay, great. So I was just looking through the hospital notes here, and it looks like you had a bit of an accident. You got hurt. Can you tell me a little bit about that?
Yes, I was in the kitchen and I was grabbing paper towel and there was a knife there and it fell onto the ground and it actually hit me and then I was gushing, and so I had to
Where
go.
did it hit you?
On my right foot, on my first big toe.
Okay. Just make a note of that. And they treated you last night here, correct, at the hospital?
They did.
Okay, so what we want to do before we release you, because it looks like I have in my notes here that you'll probably be good to go tonight, but we want to do a full head-to-toe assessment just to check for any remaining issues, anything that could have been a secondary side effect, or as long as we have you here, anything that might be bothering you at the moment, okay?
Thank you.
Okay. So let's go ahead and do a check. So I know you might be in a little bit of pain from that foot. On a scale from 1 to 10, I want you to tell me 1 being no pain, 10 being the most pain you've ever felt, what you're feeling right now.
Right now I'm not feeling anything, but if I do wiggle my toe, I do feel about a 5.
5. Okay, so if your foot's stationary, you're feeling okay,
Yes.
and then otherwise no other aches and pains at the moment.
Correct.
Okay, wonderful. All right, let's take some vital signs. I'm just going to start off getting your temperature. I'm just going to check a couple of spots here. Okay, I'm just going to get on your chest and behind your ear. Side. Okay, temperature is normal, so that's good. No major signs of infection. Let's go ahead and get your blood pressure. Do you have an arm preference?
That's fine.
Is that okay?
Yes.
Okay, just settle down. Just relax. I'm gonna set this here. Okay, you're going to feel a little bit of tightening here. So just again, keep your arm totally relaxed and let me know if it gets too painful.
Okay.
Right. Blood pressure is pretty good, slightly elevated, but it's a little bit, nerve-wracking here and nothing to be concerned about. I want to just get your oxygen and your heart rate. So this, point your finger, please. In there, just relax it. And while I do that, I'm just going to take one of your pulses, okay? Pulse is nice and strong. Okay. And it looks like you are at 99 for oxygenation, so that's perfect. All right, Kat, any questions before we begin, Katharina?
I do not have any other questions.
Okay, if you have any pain or discomfort during the course of the exam, please stop me right away.
Thank you.
So I'm going to methodically make my way from your head down to your toes. I'll save the injured foot for last. While I'm getting these on, I'm going to ask you a couple of questions. You already told me your name. Can you tell me where you are right now?
Yes, I'm at the clinic.
Okay. And about what time of day is it?
It's about 6 p.m.
Perfect. And what day of the week is it?
It's Sunday.
Very good. Can you tell me what you had for breakfast this morning?
I had eggs and toast.
Okay. And what about your favorite subject in school growing up?
Math.
Perfect. So your long-term and short-term memory seems intact. Any issues with thinking, memory, anything?
No.
Okay, we'll do a couple more neurological things later as we go, but that looks good for now. I'm going to start just taking a general look at your head. Did you hit your head at all when you got injured?
No, I did not.
Okay. Any pain when I do this?
No pain.
Okay, I'm just going to check this side. gonna comb through looking for any critters or signs of injury. Checking the other side. Hair looks nice and healthy. I'm going to touch you in a couple of spots of your head. And I just want you to tell me if you feel it, okay? It's not going to be too sharp. It's about, feels like that, all right? So close your eyes and just tell me if you feel this.
I do. Yes. 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 Yes.
Very good. So sensation of the scalp's intact. I'm just going to blow a little bit on your scalp. I want you to tell me if there's any tingling or any nerve pain that shoots down, okay? Any pain there?
No.
Feel okay?
Yes, it's comfortable.
Good. No discomfort, right?
None.
Okay. Just gonna lastly just check if you tilt your head down for me, just checking the part here. Is this where you normally part your hair?
Yes.
Okay. Just looking for any lesions or freckles. The sun often sees this spot the most, so we want to make sure we're not missing any cancerous beginnings there. Okay, and that looks great. So, that is all fine. I'm going to move down to your face now. So I'm just going to push this out of the way. And just get this nice and clear. Don't see any bumps or scrapes. Very slightly for me. Very good. Any pain when I press on your sinuses
None.
there? How about here?
No.
To your docs there? Okay.
No.
All right, I'm just going to palpate everything. Okay, eyebrows are nice and symmetrical too. Good. Take a look into your eyes, starting out with testing your pupillary reactions here. So just like straight ahead for me, right out there. And it feels a little bit bright, so I apologize for any discomfort here. Okay, good. I'm going to shine light right in the middle. Okay. I want you to take a look at my pen. Any double vision here?
No.
Okay, follow it everywhere it goes, just with your eyes, not moving your head. Any double vision while I do this?
No.
Good, no nystagmus. Go ahead and look way out there for me and ignore this. And now look at it and look back and look at the pen. Follow it out and follow it in. Good. Now it's a little cross-eyedness, but that's totally normal. All right, I'm going to take a little closer look into your eyes. I'm just going to get a little close to you, so again, stare straight over there, and I'm going to come in close and looking into the eye. Okay, very good. The same thing on this side. And just keep looking over there. Very good. I'm going to test you with the Snellen chart. So, can you, do you have any issues with vision? Do you wear glasses or contacts?
No.
Okay. Can you read with both eyes this line for me, please?
EPTZO.
Okay. And cover one eye for me. And can you read the same line backwards?
OZTPE.
Okay. And cover the other eye. And read this line forwards.
CFDHJ.
Okay. Very good. Just checking the pupils. You got all those correct. Perfect. I'll give you a card here. I just want you to cover one of your eyes. You can choose. And stare right at me, right at my nose. And you just turn towards me a little bit. You just stare right at my nose. And just tell me when you see my fingers wiggling.
I see them wiggling.
And you just say now when you see it.
I see them.
Okay.
I see them.
Keep looking at my nose. Try that one again.
I see them.
Perfect.
I see them.
Switch eyes for me. Same thing. Stare at my nose.
I see them.
Good.
I see them. Now. Now.
Okay, very good. I'll take that from you. Do one last peripheral test here. Again, stare at my nose and just tell me if it's right or left wiggling.
Left. Both. Right. Left.
Good.
Both. Left. Both.
Perfect. I'm going to ask you to tell me what some of these colors are. I'm going to check your ability to differentiate colors. So just about the color, so it doesn't have to be a perfect shade or anything. About what color is this?
Purple.
Okay, great. And this color?
Yellow.
And this color?
Orange.
Very good. So it seems like you can differentiate colors along the spectrum there, which is wonderful. Let's make sure there's not anything else I want to do with the vision. I think that's okay. You said no problems with vision, right? No, is any issue seeing at night?
Actually, I do have static at night.
You do, okay. And is that something you're able to still function with?
Yes.
Okay. I would definitely recommend going to the eye doctor at least once a year to just make sure that that's not getting worse. And of course, be careful operating heavy machinery in the evenings.
Thank you.
Let's take a look at your nose. So first I'll just look inside of it. Can you tilt your head back for me, please? Any issues with smelling or breathing out of your nose?
No.
Looks nice and clear. Tilt down. I'm going to have you cover one nose and breathe in for me. Okay, and the other side, breathe in for me. Okay, a little bit of occlusion, but is that normal for you this time of year?
Allergies.
Yeah, it's definitely allergy season, so no problem. I'm going to give you a couple of things to smell. If you just put out your top of your hand for me, I'm just going to roll it right here and have a smell of that for me.
Lavender.
Perfect. And the other hand, please. Go ahead and smell that for me.
Chocolate.
Perfect. Smelling is intact, nose is intact, no worries there. Take a look into your ears. So just looking at the outside first. You have one piercing. Backs look good. Any pain when I press there
No.
or there?
No.
You ever have any issues with the piercing? How long have you had that?
I had them for a couple months. I was allergic and then realized I could only handle titanium.
Okay. And
Other
that's
than that, no problem.
since switching to that titanium, you haven't had any bubbling of the skin or irritation?
No.
Okay, perfect. Checking this side. Okay. Let's take a look inside of them. Nice and clear, not red. Looks like you're in really good shape so far. Do some hearing tests. Starting out with a tuning fork. I'm going to hit this, put it on the top of your head, and I want you to tell me if you hear it more left, right, or both. Left, right, or both?
Both.
Equally.
Ish.
Let's try one more time. Left, right, or both equally. That's my mistake.
Both equally.
Perfect. Can you hear this in the back here?
A little, yes.
Tell me when it goes away completely.
No.
Can you hear it there?
I can.
Great. Same thing on this side. Tell me when it goes away completely.
Now.
Can you hear it there?
I can.
And make some really soft sounds now next to your ears, and just tell me left, right, or both.
Left. Right. Left.
Mm-hmm.
Right. Both. Both.
Okay, perfect. I'm going to whisper something in your ear. I'm just going to close this one and tell me what I say. Green.
Green.
Lemon.
Lemon.
Apple. Apple. Okay. On this side. Purple.
Purple.
Banana.
Banana.
Door.
Door.
Okay, wonderful. So it sounds like your hearing's good. No issues, right?
Right.
All right. Let's move on to your mouth here. And how often are you going to the dentist?
I just had a cleaning last week.
Okay. And they didn't see any problems in there?
I had a few fillings, so I got them filled.
Okay. And fillings are settling in okay? No bite issues with them?
Everything is great.
Okay, wonderful. So I just want to look into the back of your throat then. So I'm going to have you open up and say ah. Very good. I'm just taking a look at your teeth. And those fillings look great. Very good. Okay, you can relax. I'm going to give you something really small to taste here, and I just want you to put out your tongue a little. Okay, and what do you taste?
Cherry.
Cherry's perfect. Definitely in the berry family somewhere in there at least. So that's great. So you can differentiate sweets from sours and salties. Can you use the tongue on the inside of your mouth to just push into my hand? Okay. And this side. You stick your tongue out and move it side to side. Good. Good symmetry there. No drooping. As long as I'm having you make some funny faces, can you puff your cheeks out for me and hold them? Okay, and smile for me. Perfect. Raise your eyebrows and close your eyes really tight. Don't let me open them. Good. I'm going to have you open and close your jaw for me. Okay, good. No clicking. One more time. Good. Just feeling those muscles there. Any pain or discomfort with opening the mouth?
Just a little tender, but it's fine.
Tender, okay. Tender when I touch or when you do it?
When I do it.
Okay. Is that gotten worse over time, or do you clench your jaw at night, do you know?
I clench my jaw at night.
Do you wear a retainer?
I don't.
Maybe next time you go to the dentist, ask them about that, or you can buy it over the counter and mold it yourself. Just get them offline. That will really help with at least the impact on your teeth, because over time, teeth will grind down and fracture a little bit with that grinding, okay?
Thank you for letting me know.
So I just feel here. I'm going to feel for the lymph nodes. Shrug your shoulders for me, please. Okay. While you have them up, I'm going to push down. Don't let me push down. Okay, and relax. Turn your head against my hand. Don't let me push you. Good. And this side. Push against. Perfect. Push against my hand forward. Good. And pull back. All right, so the neck muscles are all really strong. Do you ever have issues with tension in the shoulders?
I do.
Yeah, they feel very tight. Definitely yoga, stretching, chiropractic, that type of thing, massage. So that looks good in the face. I'm just going to move down to the body now. Feel your joints here and just relax. Just feeling for any crepitus, any popping, clicking. Side. I'm going to have you make a couple of motions for me. I want you to lift your arms up from the side. Any pain with that?
No.
Can you turn them in and clap them up? Any discomfort there?
No.
Okay. Down, back, behind you like that?
No.
Okay. And then up and down here. Very good. I want to test a couple of those things with your strength. In good range of motion though. So arms up again, and don't let me pull you. Don't let me push. Okay, up like this, and test the shoulders. Don't let me push you down. Don't let me pull you up. And with the hands, can you put them back? Don't let me pull. Push against me. And just the fingers, the thumbs up there. Strong, strong. Feet, hands out like this. Don't let me close them. Okay, and hands nice and tight, closed, and don't let me open. Very good. Okay, you can go ahead and relax. I'm going to do a bit of upper body sensation. So like I did on your head, if you can feel it, but I'm going to do it with a really light cotton wisp like that. So I'm going to do your face and your arms, and I want you to just say yes when you feel it, and keep those eyes closed so you can't tell when I'm touching you.
Yes. 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 Yes.
Did that feel the same side to side?
It did.
This and this? Same?
Yes.
Okay. Moving down to the arms. Say yes when you feel it.
Yes. 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 Yes.
Turn the hands over for me. Perfect.
Yes. 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 Yes.
Good. Moving on the other side.
Yes. 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 Yes.
Okay, great. And that felt equal side to side like that?
It did.
All right, I'm going to do a bit of a rough point versus the soft point. Do you feel the difference between that and that?
I do.
Okay, so close your eyes and just say sharp or dull.
Sharp.
Good.
Dull. Sharp. 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 Dull. Dull. Sharp.
Mm-hmm.
Sharp.
Good.
Dull. Sharp. Sharp. Dull. Sharp. Dull.
Good.
Dull.
Good. Now I just want to make sure that the sharpness sensation is the same all the way down. So I have a little bit more of a sharp edge here. So I want to just show you really lightly on your chest. And I want you to just let me know if it's same sharpness all the way down your arms, okay? Does that feel just as sharp all the way down?
It does.
Okay. Same thing on this side. Just as sharp the whole way.
It does.
Do it really lightly on your face as well, but I want to do it hard enough that you actually do feel the sharpness. Any
Yes,
sensation
I do feel
loss?
that.
Okay. No sensation loss on the way down. It feels the same the whole way.
Yes.
Okay, very good. I'm going to hit that same tuning fork, and you're either going to feel just this pressure or the vibration. Do you feel the difference?
I do.
Okay, so close your eyes. Pressure or vibration, depending on what you feel.
Vibration. Vibration. Pressure.
Okay,
Pressure.
good.
Vibration. Pressure. Vibration. Vibration. Pressure.
Okay. Next one's going to be with your hands. I have just a tweezer right here, and I have 2 points or 1 point like that. And just say 1 or 2 in a couple of spots here.
2.
Good.
2. 1. 1.
Very good. Same thing on the other side.
2. 2. 1. 1.
Very good. While I have this hand, I'm going to move your finger up or down like this. This is down, this is up. Close your eyes and tell me up or down.
Up. Down. Down. Up.
Okay?
Down. Down. Up. Up.
Very good. I'm going to draw something in your hand. It's going to be a number. I want you to tell me what that number is. Close your eyes.
3.
Very good. And again.
3 again.
And add those two together. What do you get?
6.
Okay. And the other hand, I'm going to spell a word now.
C.
Another letter.
A. T.
Okay, perfect. What does that spell?
Cat.
And what is a cat?
An animal.
Very good. So that not only tests your ability to feel with proprioception, but also your ability to think logically and put together letters and words and ideas. Let's test some of the reflexes in your upper body here. So just give me all the weight. There you go. Just relax. Okay, good. Side here. Over here, same thing. Just give me all the weight. There you go. Open your eyes and look over there. I'm going to scrape your hand. Same thing, don't pay attention. Very good. Okay, put your arms out straight ahead of you and keep them there, and then close your eyes for me. And don't move them. And flip them over for me. And don't move them. With this finger, touch your nose. Okay, and now with this finger. Very good. I want you to open your eyes. You can put one arm down, whichever you prefer. You're going to take your pointer finger, touch your nose, and touch my finger. You can keep looking at it as it moves. Very good. And same thing with the other pointer finger. Touch my finger, touch your nose, and back. Good. I want you to, on your legs, you go back and forth as fast as you can. So all of your rapid alternating movements are intact. Let's take a listen to the heart. And just breathe normally for me, please. Lift this arm for me. Just up a little. There you go. Perfect. Thank you. Heart sounds good. Just want to quickly check the pulses here. Making sure they're symmetrical and even. They are. I'm going to listen to your lungs now, and I'm going to have you take just a regular sized breath every time I touch you. Okay. Sounds clear, no crackling. I'll be tapping here on the lungs. Please for me. Thank you. Okay, good. I'm going to put my hands like this on your chest. I want you to say 99 when you feel my hands.
99. 99. 99.
Great. For the next part of the exam, I'm going to have you swing around, and I'm going to take a look at your back. All right, Katharina, I'm just going to take a look at the back here and do the same thing with the lung sounds. So again, when you feel my stethoscope touch you, I just want you to take a normal breath. Okay, good. Do a little more tapping here. And say 99 when you feel my hands.
99. 99. 99.
Good. I want you to take a nice deep breath in. Good expansion and release. Very good. I'm just going to have you take a big breath in and hold it. And let it all out. And hold that. Okay, perfect. I'm just going to feel along your spine here. Any pain or tenderness along the spine?
No.
Checking the muscles on either side there. Again, pretty tight, the lower back and this upper back area. but other than leading to some, do you ever get headaches or anything like that?
I do. I think they're hormonal though.
Okay. All right, that seems fine. Can you turn to your right for me? Twist like this. Very good. And the other way. Good. And can you go down with your arm there? Yep, good. And on that side. And then just put your head forward, roll forward, bend the spine. Any pain or anything with that?
No.
Okay, come on back up. Any tenderness on the kidneys there?
No.
Okay. And that looks fine to me. Doesn't look like there's any sort of curve in the spine, very straight. Okay, so go ahead and lay your head that way, your feet this way, and we'll continue with the lower body.
Thank you.
All right, now that I have you laying down, I'm just going to take a look at your legs, just feeling the joints here in the hips. Any issues with exercise or pain or swelling?
No.
Okay. Checking the joints, checking for any edema. Just going to be careful around that foot. This one on this side here, or which one?
Yes.
The left side?
Right on top of the big toe.
Okay. Okay. Now have you lift this leg up, straight up, and can you resist me? Any pain with that?
No.
And down? Good. And same thing on the other side. Lift leg up, resist me, and down. Okay. Can you bend this leg up towards your hip? There you go. I'm just going to move it a little bit for you. Does that sound feels okay?
Yes.
Right. Push against me. Push. Try to push out with the ankle. There you go. And pull in. Any pain?
No.
Okay. And on this side, again, I'm just going to move it, but just be gentle with it. I don't want you to hurt the foot. And is it too painful to put your foot like this?
No, it's fine.
Okay. And can you give me a push against me and pull against me? All right. Very good. You can relax that. So I'm just going to do that really sharp roller pinwheel down the legs. You should be able to feel it through the leggings, but let me know if you can't. Can you feel the sharpness there?
Yes, I can.
Okay, and just tell me if it feels the same sharpness all the way down. Does that feel the same all the way down?
Yes.
Onto the foot, the same?
Yes.
Okay, and same thing on the side. Does it feel the same sharpness all the way down?
Yes.
Okay.
Yes.
And I'll just be careful with that foot there. Just want to feel the temperature here. And it's a little hard to feel through the leggings, but any cold, super cold feet or tingling in the feet? Any sensation issues?
Just a little bit in the one that I had the cut in.
Okay. Okay. And that's only been since you injured it though, right?
That's correct.
I just want to take one last look at your belly here while you're laying down, and then I think you're all set. I'm just going to lift this up just for a second. I just want to look to see if there's nothing good. No moles or lesions I'm worried about. Nice and flat. Go ahead and put that down. Let's just take a listen. Okay, good. Good. Bowel movements heard in all 4 quadrants. Same thing, I'm just going to do a couple light taps. I'm going to push just a little bit harder now. Let me know if there's any discomfort or pain. All that's okay?
Yes.
I'm just going to feel for your kidneys under here. Can't palpate. And so there's no swelling. That's good. All right, go ahead and sit up for me. I just want to get the reflexes in your knees and you'll be good to go. Okay. So reflexes are good in the knees. I'm going to skip the ankle for today just because that's such a sensitive area on you. All right, Katharina, well, I think you're in good shape to leave tonight. I'm happy to see that the cut is healing nicely, and I just want you to keep an eye on everything and really make sure you're checking it and checking the bandage and make sure there's no seepage, nothing coming through there, okay?
I definitely will. Thank you so much.
Thank you, and I hope you feel better soon.
Thank you.
Hi there, I'm Dr. B.
Hi.
Nice to meet you.
Nice to meet you.
I'm going to be doing your comprehensive eye exam today, okay?
Okay.
So before we begin, I'm just going to go ahead and confirm your first name for me, please.
It's Debbie.
Debbie, okay, great. And that is what I have here in my chart. So what I'll be doing today is just taking a look at both the exterior and the interior of your eyes, testing some of your vision, your color, making sure there's no nystagmus or any issues with the corneas of your eyes, and just doing an overall health and wellness check. Before we begin, is there anything specific that's bothering you today?
Well, I have been noticing that it's very hard for me to see far distances.
Far away, okay.
Yeah.
And is that so when you're reading, when you're driving, all of the above?
I would say definitely when I'm driving.
Mm-hmm.
Reading as well, when I'm close up too, can also have that
Okay.
problem.
Are you experiencing blurriness of your vision?
A little bit of blurriness.
And that gets worse when you get further away.
Mhm. Yeah.
Okay, we'll definitely check that out. Any issues with double vision?
I haven't noticed any double vision.
Okay, great. Any floaters or things in your eyes and your vision that seem like they're not there in real life?
Occasionally, if I'm in bright sunlight, yes.
Okay, that's totally normal, so not too worried about that. Okay. Any pain behind your eyes?
Not that I've noticed.
How about straining when you're looking far distances?
Definitely, I've noticed some straining, yes.
Okay, and does that lead to any headaches or anything like that?
Mhm.
Okay. Okay. So I'm going to go ahead and start the exam now. First thing I'm going to do is just take a quick look into your eyes. I'm going to check for symmetry of the pupil reacting to light. Just stare right over my shoulder for me, and there's going to be a bright light, so you might experience those spots that you mentioned, okay? That's totally normal. Good. Good. Okay. Pupils all reactive. Just taking a look. Can you go ahead and follow my pen everywhere it goes and keep staring at the pen? Don't move your head at all, okay? And tell me if you have any double vision or trouble seeing blurriness with this. Should be pretty close to. How was that? Was there any double vision there?
No double vision there.
Any blurriness?
A little bit of blurriness, yes.
Okay. I'm going to move the pen from
Okay.
out here to in here.
Mhm.
I'm just watching your eyes, so just follow it all the way in. I'm going to go a little cross-eyed. That's good. Good. I want you to tell me where it starts to get blurry. So how is it here?
That's okay.
Okay, tell me when it starts to get blurry.
Right about there.
Right about there, okay. Just based on vision, that's about 24 inches from your face. So that will pass the near vision where you're just staring at your phone or looking at a book and into the more of the distance, far-sighted vision, okay? So I'm going to take a little look at your pupils here. You're at about a 4 on that side. Same thing on that side, 4, 5. There's a light source coming from this side, so it makes sense that this side would be just a bit smaller. Just checking over your eyes. I'm going to put on some gloves. I want to take a look at the eye itself. Okay, so gently look up for me. I'm just looking at the whites of your eyes. Okay, the other side. Okay, can you look down for me? Any pain when I press here?
A little sensitivity.
A little sensitivity, okay. Could be from that eye straining that you're experiencing, that your eyes are feeling a little bit tender. I'm just taking a look. Any pain in the sinuses?
No, I'm okay there.
Okay. And how about those tear ducts here? Is that okay?
Yeah, that's okay.
Perfect. Everything looks nice and symmetrical with the eyes closed. Not seeing any bruising or impacts on the eyes themselves. Okay, go ahead and gently open your eyes. I'm going to take a closer look at the back of your eye. So just stare over my shoulder. I'm going to get a little bit close. I'm sorry if it's uncomfortable. I do see that red reflex intact there. Same thing on the other side. Okay. Well, I've got my kit out here. I'm going to give you a chart to read. With our eyes, our ability to see at distances is compared to 20, 20, or would be regular vision. And that means that at 20 feet, you can see what the normal average person can see at 20 feet, okay? So we'll go ahead and test this. So hold that about here, about 24 inches from your face. I want to see that point where you had some blurriness. And can you read this line here?
O-L-C F.
Very good. And can you cover one eye and read the same line?
O-L. The C is a little bit blurry, and F.
Good. And cover the other eye and read it backwards. I'm not going to hold that for you.
F-C-L-O.
Good. Okay. So that was about 20/50, and you did struggle just a little bit there. Can you read any, with both eyes, can you read any of the line below?
Z, D, H. Can't really tell what the third one is. I think that's a B, and but I'm not sure. And then S.
Okay, good. Yeah, so a couple of missed ones there. It just confirms that your vision right now stands between about 20/50 and 20/40 for your farsightedness. And actually, while I have this chart out nice and close here, can you tell me what that color is?
It's red.
Great. And what about this color?
It's green.
Perfect. Do you have any issues with color blindness or discerning color?
Not that I know of.
Excellent. Give you a card.
Okay.
I want you to hold it over your right eye. I'm going to cover my right eye. I want you to stare straight at my nose. I'm going to bring my hands in and want you to tell me yes when you see my finger wiggling.
Yes.
Good.
Yes.
Good.
Yes.
Okay, and switch eyes for me.
Yes. Yes. Yes.
Perfect. So no problems with your peripheral vision there. That's excellent. I want you to stare straight at my nose again. I'm going to hold up fingers, and I want you to tell me left or right. Depends on which one's moving, okay?
Left. And right. Left. Right. Right. Left.
Okay. And if I bring them out here, can you tell me which ones?
Both.
Good. Okay. So you're seeing big objects and movements, okay, from that distance. It's more reading small letters, things like that. That's great. So I'm not worried about you walking out on the street today not being able to see. I want to try just a pair of lenses on you that are built for distance and see if that improves your vision at all, okay?
Okay.
So I think these ones here will work. So go ahead and just put those on. I'm going to get that chart out again and have you read it again, okay?
Okay.
So once again, I've got this chart for you here. I want you to go ahead and read this line with both eyes.
So that is D, H, J, B, S.
Very good. So that was much easier
Yeah.
for you. Okay. Can you try the one below it?
It is E, P, T, Z, O.
Very good. Okay. And last challenge, I'll bring this just a little bit closer to you. What about this line right here?
So that is C, F, I think that's a D, H, and it's a J.
So just a couple that you missed there, but honestly much better. So that brought you down to about 20/30 or 20/25. Probably a slightly stronger lens there in those, but that's telling me that those reading glasses are really, really helping improve your vision. That's excellent. So I'll go ahead and take those back. And we'll make sure to make an appointment to get you fitted for your own personalized pair of glasses. But I'm not worried about it being any sort of hereditary vision loss, anything more severe at this time. Have you had any issues in your family with hereditary continuing vision loss?
Not that I know of.
No. Does anyone else wear reading glasses?
Yes.
Okay. So
My
that,
mom and my dad both wear it.
unfortunately, sometimes when it runs in the family, there's not that much we can do about it. Just going to note a couple of these things, okay? Okay, so we tested a bunch of vision today. Red reflex intact. Did you have any other questions for me while we were here today?
No, I think that's it.
Great.
Yeah, thank you so much.
All right, well, I've got that all noted in your file. So what I'm going to do is write you a prescription to go to the optometrist and get that pair of distance glasses. If it doesn't help, if you continue to feel those headaches, I want you to come back because we'll take a deeper look at some of the other things that could be going on in that area, okay?
Okay, and how often do you normally come back just for a regular checkup if everything is okay?
I would say once a year.
Okay.
Come back, we'll just check you out as long as your glasses are still working for you. If you feel like you're starting to have that blurriness again, even with your glasses, then it might be time to to change that prescription for the type of lens that you have, okay?
Okay, great.
Well, nice to meet you, Debbie.
Very nice to meet you.
Thank you for coming in today.
Thank you.
Hi, Veronica. I'm Dr. B. I'm going to be performing a head-to-toe assessment on you. It's going to involve me starting at your head and working my way down the body to check everything's working fine, no functionality issues, and no issues we need to look into further. Does that sound okay?
Mm-hmm.
All right. So I'm going to have you confirm a couple of things for me. Can you state your first name?
Veronica.
Okay. And where are we right now? What space are we in?
The doctor's office.
Okay. And what's the day of the week?
Wednesday.
And about what time?
3:30.
Okay, perfect. You're oriented to person, place, and time. I'm going to ask you some memory questions. I'm going to give you a couple of words to remember, and I'll ask you again in a few minutes. So I'll give you a dog, boat, and road. Can you repeat those back to me now?
Dog, boat, road.
Okay, keep those in your mind. I'm going to ask you again in just a couple of minutes. Now I'm going to ask you a couple of questions that looks into more of your deep memory, your long-term memory. Can you tell me who the first president of the United States was?
George Washington.
Perfect. And who is the current president?
Biden.
Okay. And what did you have for breakfast this morning?
A scone.
Great. And what were those three words I asked you?
Dog, boat, road.
Perfect. Memory looks great. No problems with thinking or retaining information?
No.
Okay. Perfect. All right, so let's go ahead and get started with the physical exam now. And like I said, I am going to be starting at your head and working my way down. And if you have any discomfort while we perform the exam, please just stop me right away, okay?
Thank you.
I'll sanitize my hands. And while I'm doing this, are you currently in any pain?
No.
Okay, so on a scale from 1 to 10, 1 being no pain, 10 being most pain you've ever been in, you would be a...
A 1.
Perfect. I'm going to start by just looking through your hair. And I'm just going to give it a little bit of a feel here. I want you to tell me if there's any pain when I touch.
Mm-hmm.
Do you ever get headaches?
Not often, no.
Okay, good. I'm just going to be checking through it as well, looking at the scalp, the hair consistency. It does look very healthy, fresh. How often are you washing the hair?
Once every 4 to 5 days.
Okay, perfect. We just want to make sure you're not overwashing that scalp, causing dryness and irritation. So it looks like you're doing that, everything right there. Any itchiness within the scalp?
Mm-mm.
Roots look nice and healthy. I'm not seeing any bumps or lumps on the scalp itself. Sorry about that. Any contact with wooded areas where you might have picked up a tick or anything like that?
Not too recently.
Okay. One place they sometimes like to hide is in the hair, and then it's harder to catch those bullseye symptoms. So just going to check the back here a little. Other side. Okay, that looks fine. I'll let you put your head back up now, and you can just fix your hair if you'd like. Sorry, I messed it up a little. I'm going to be touching your face now, so I am going to put on some gloves so I don't transfer any of the oils on my skin. Any issues with your face? Any dripping or tingling in your face?
Not in my face, no.
I'm just going to move this back here if you don't mind, so I can take a full look. I'm looking at symmetry. Eyebrows look nice and symmetrical. Hair distribution is good. I'm going to be feeling around your head. Just any pain right here?
Mm-mm.
Okay, what about right here?
No.
That's okay?
Mm-hmm.
Okay, great. Just taking a look. I'm going to have you make some faces for me. So I want you to smile. And can you puff out your cheeks and hold them? Okay, good. Nice and strong. Can you lift your eyebrows up? Okay. And close your eyes as tight as you can, and don't let me open them. Perfect. Skin looks good. I'm just going to look a little closer with my light. Very clear, though. You do have some freckles. Is that typical for you? You've had those a long time?
Mm-hmm.
Okay. Are you wearing sun protection?
70 SPF.
Okay, perfect. Yeah, you are fair skin, so we just want to make sure that you're not getting too much sun exposure. But the skin looks really healthy, moisturized. Close your eyes for me. It looks great. I'm going to be feeling your lymph nodes in your neck now. So I'm just going to be feeling for any lumps or enlargements. Show your shoulders for me. Feeling in there. Okay, and relax. Any pain while I'm doing this?
Mm-mm.
I'm going to do a little bit of sensation on your face. So what I'm looking for is to see if you can feel it on both sides equally, as well as differentiate between some different sensations. So I'll have you close your eyes while I do this, and just say yes when you feel it.
Yes. 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 Yes.
Okay, so that felt the same on side to side.
Mm-hmm.
This feels like that.
Mm-hmm.
Okay. Next, we're going to test your sharp and dull sensation. So we want to see if you can tell the difference between a light touch So I'm going to test out your chest here. You feel that?
Mm-hmm.
And then the difference between that and this. It's a little sharp, but it won't break the skin. Okay?
Mm-hmm.
So keep your eyes closed and just tell me sharp or dull.
Dull.
Mm-hmm.
Dull.
Good.
Sharp.
Okay.
Sharp.
Good.
Dull. 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 Sharp.
Good. One more time.
Dull. Sharp. Dull. Dull. Dull.
Perfect. Last thing I had for you is a bit of cool metal. You can feel it. It's quite cold. Okay, close your eyes and just tell me when you feel the cold.
Cold. Yes.
Is this cold or warm?
Warm.
Cold or warm?
Cold.
Cold or warm?
Warm. Cold.
All right, I'm going to have you keep your eyes closed. I'm going to hit the tuning fork and tell me what you feel.
Oh, vibrations.
Have it on this side.
Yeah.
Okay, perfect. Fully intact there. So no problem with sensation. I'm going to have you open and close your jaw for me. A little bit of clicking there. Is that normal for you?
Mm-hmm.
Does that bother you a lot?
No.
Okay. If that gets worse or if you're having trouble eating, we can definitely take a deeper look at that. But feeling just that masseter muscle there. Can you do it one more time? Just to clench your teeth. Okay, the muscle's strong. Can you push against me? Okay, yeah. So no pain while you're doing that push there? No shooting pains up in there? Okay. I want to take a look into your ears. So I'm going to have you turn your head that way. Just going to touch it here. Any pain there? Or there?
No.
Okay. All right, it looks nice and clear. Can you hear this noise here?
Yeah.
Okay. Turn to the other side. And again, any pain? Touch that?
No.
Okay. Great. A little bit of earwax, but nothing major. Do you have ear infections ever? Do you ever get congested?
When I was a child, a lot.
Okay, yeah, so there's definitely a little bit of scarring, a little bit of swelling in there, but you hear that too?
Yeah.
All right, let's do a little bit of a finer hearing test just because there is some of that swelling and scarring there. So close your eyes for me. I'm going to make a sound, and I just want you to say left or right,
Okay.
whatever side you hear it on.
Left. Left. Right. Right. Left.
Okay. Same thing, just with a little bit softer, a little finer. So say left, right, or both.
Both. Left. Above. Both. Right.
Perfect. So your hearing seems completely intact. You don't have any trouble hearing generally. Listening and hearing are different, of course, but as long as you don't have any trouble hearing, we're good. All right, let's take a look into those eyes. So just look straight ahead for me, ignore my light. I'm going to shine it in your eyes, and it might be a little bit uncomfortable, but I'll try and be quick, okay? I'm just checking for the pupillary reaction here. Good. Okay, I'm going to stare right in the middle there. Just want to see where it's reflecting. Okay. Just taking a look at the eyes. You close them for me and open them. Any issues with tearing or dryness?
No.
Okay, look up for me. And look down for me. All right. I'm going to have you follow my pen. So can you see it here? Is it blurry at all? Okay. Follow it everywhere it goes, just moving your eyes, not your head. Let me know if you have any double vision or blurriness when I do this. Everything look clear still?
Mm-hmm.
Okay. I want you to stare straight out there. Ignore my pen. Now look at the pen. And follow it out. And follow it in. Okay. Obviously you'll get a little bit of double vision as I get closer, but I didn't see any nystagmus or pupils reacted appropriately. Okay.
Mm-hmm.
I'll have you read my chart here. And do you wear any glasses or contacts on a regular basis?
Mm.
So I want you to go ahead and read this line forwards for me.
EPTZO.
Okay. I want you to cover one eye. And I want you to read it backwards for me.
OZTPE.
Okay. Can you cover the other eye? And can you read this line?
CFDHJ.
Okay. No vision problems there. What color is this?
Red.
And what color is that?
Green.
The pupils. And we're at about a 3 to 4, which is perfectly normal for this level of light. Okay. I want you to stare straight at my nose. I'm going to check your peripheral vision. So I'm going to move my fingers in, and I want you to tell me when you see them wiggling. Just say yes.
Yes. Yes. Yes.
Okay, same thing, just with this chart. Cover one of your eyes. Keep staring at my nose. Say yes when you see it.
Yes. 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 Yes.
Okay, switch eyes.
Yes. 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 Yes.
Very good. No problems with that? Dizziness, blurriness? Okay. All right, so the eyes look good. Let me take a look into the mouth. So just open up and say ah. Okay, palate rises. Looks good, nice and healthy. How often are you seeing the dentist?
Often.
Every year at least?
Yeah.
Okay, perfect. And as long as they're doing regular checkups, then you should be fine there. Can you stick your tongue out for me and move it that way and that way? And then back in your mouth, push it into my hand here, checking the strength. And on this side. Okay, very good. I'm going to look at your nose now. Just dip back here. Any stuffiness, trouble breathing?
Mm-mm.
Just going to inspect the outside. You do have a nose ring there.
Mm-hmm.
Do you have any issues with infection or irritation?
No.
I'm going to give you a couple of things to smell. So close your eyes for me and just tell me what you smell.
Is that mint?
Mm-hmm. Perfect. And give you one more. Just take a deep breath and tell me generally what you smell here.
Is that lavender?
Yep, perfect. All right, so sense of smell is completely intact. Just going to do a couple of hearing tests that I missed on the first time. So I'm going to hit this, put it in the center of your head, tell me which side you hear it more on or if it's equal.
The right side.
Hear it more on the right side? Okay, we'll do one more time. Right side, left side, or equal?
Equal.
Okay, perfect. I'm going to hit it again, put it on the back of your ear right here. Tell me when it goes away.
Okay. Okay.
Can you hear it here?
Mm-hmm.
Same thing.
Okay. Mm-hmm.
Alright, I'm going to move down to your neck and your chest now. Just want to feel here and check your pulse. Nice and strong, 2+. And take a listen. Just breathe normally, right, please. While I have this out, I'm going to move down to your chest I'm just going to listen in about 4 spots in the lungs here. Take a breath for me and out. Breathe in for me. One more time. And last one. Okay. Any trouble breathing, issues with asthma, catching your breath? I'm just going to tap on your chest in a couple places here. I'm listening for the sound of the lungs, make sure everything's clear. Okay. Can you take a big breath in for me and out? I'm just looking at the chest expansion. And that looks normal to me. Now listen to your heart. Any problems with pounding of the heart? Feeling lightheaded? Anything like that?
No.
Okay. You can breathe normally here. Just going to listen to a couple of the quadrants here. Very good. Didn't hear any murmurs or irregular heartbeat there. Okay. I'm going to have you turn around, and I'm going to do a little bit of work on your back now.
Okay.
All right, Veronica. So again, I'm just going to do very similar things on your back here. I'm just going to listen to your lungs. So again, in 4 places, just take a big breath when you feel my stethoscope. Good. Doing same tapping again. Any pain when I hit you here? How about there? Can you take a nice deep breath for me? And relax. Very good. I'm going to put my hands on your back. I want you to say 99 when you feel my hands.
99, 99, 99, 99.
Very good. Taking a look at your spine now. Lungs look clear, sound good. I'm going to be pressing on just the spine here itself. Let me know if anything's painful or tender when I do this.
Okay.
Checking for any scoliosis or bends in the spine. Feels pretty straight. Have you ever had any problem with spinal pain or tenderness? Okay. Can you tuck your head forward for me as if you were going to roll down? Just sort of curl your body over, pull your shoulders over, and come up straight for me. Okay. Can you turn to your right? Okay, and to your left. Good. No pain there.
Mm-mm.
All right. And just feeling the muscles on either side as well for tightness. I think that's fine. So you can turn back around now, Veronica. I'm going to have you lay back. So let me just grab you a pillow.
Thank you.
All right, go ahead and lay your head down this way and your legs out that way for me, please.
Okay.
All right, Veronica, I'm going to have you put your arms to the side. I'm just going to take a listen to your stomach. How is your diet generally? Do you eat a lot of fruits and vegetables, or what would be a normal, typical day for you?
It's mostly vegetable based. Chickpeas and different vegetable based proteins. I do eat meat sometimes, but it's not normal.
Okay. And do you feel like you have enough energy throughout the day? Do you take any vitamin supplements, vitamin D, vitamin E, that kind of thing?
I do take vitamin supplements, yes.
Okay, perfect. So let me take a listen here. I do hear bowel movements in all 4 quadrants. So that's very good. I'm going to do some gentle pressing on your stomach here. Let me know if there's any pain.
Mm-hmm.
Any pain when I press them like that?
No.
Okay. About right here. Everything's okay. All right. While I have you here, I'm going to do a little bit of range of motion with your legs. So I want you to pull this knee up to your chest and back down. Any pain with that?
No.
All right. Can you put it up again for me, like this? Put it down. Put your foot down, and just keep it there. Don't let me pull it out. Okay. And now try and push me away. Good. I'm gonna just do a little bit of range of motion with your knee here. Any pain in the hip when I do this? Okay. You can go ahead and put that down. Same thing on the other side. Bring your knee up to your chest and back down. Up for me to do the strength. Don't let me push you down. Push me away. There you go. A little cracking there. Is that painful when that happened? Okay. And pull me towards you. Pull me towards you. There you go. And just set that down. I just want to feel the knee, because that was a bit of a pop. Feel for any swelling. Do you ever get soreness in your knees after exercise?
No.
Okay. So it just seems like you have a bit of a space in that joint, and you get that gas popping between the joints relatively often, it seems.
Yeah.
Okay, just feel the other side just to be sure. Can you push up on my hands? Good. And on this side. Good. I'm going to just pull these up to the knee, if that's okay. I'm going to do that same sensation testing that we did before. I'm going to start with just telling me you can feel it, and just say yes.
Yes. Yes. Yes.
Next is the sharp or dull. So again, just say sharp or dull, and you remember what that feels like? Okay.
Dull. Dull. Sharp. 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 Dull. 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 Sharp.
Okay.
Dull or sharp.
Mm-hmm.
Dull. Dull. Sharp. Sharp. Dull.
Very good. I'm going to run my fingers on either your leg, and I want you to tell me left, right, or both.
Right. Both. Left.
Okay.
Right. Both.
Perfect. And last thing is that sensation, or that vibration testing again. So I'm going to hit this, and I want you to tell me the difference between vibration, which feels like that, and pressure, like that. Okay?
Okay.
So close your eyes and tell me vibration or pressure.
Vibration. Pressure. Vibration. Pressure.
Okay? And that again.
Vibration. Vibration. Pressure.
Just want to test some of the reflexes while you're laying down, and then we'll have you sit up to finish out the exam.
Okay.
So just relax completely in my arms. Just go completely loose. There you go. Okay, perfect. Same thing on the other side. I want you to clench your teeth on the count of 3. 1, 2, 3, clench. Okay. Same thing on your ankles here, so I'm just going to bend this like that and just completely relax on the table. Same thing on the other side. Just completely relax. Okay. I'm going to scrape this on the bottom of your foot. It's going to be a little uncomfortable. Okay, good. And we're just looking to make sure the toes don't flare out and they went down, so that's perfect. All right, swing your legs around for me, Veronica. We're going to finish up just doing some range of motion and strengthen those arms. So I'm just going to have you lift your arms up all the way. Any pain in the shoulders when you do that? Okay, go like this, and out, and up like this. Hold it there. Good. Out like this again, Don't let me pull you. Don't let me push you. Once your hands go down, don't let me pull them. Nice and strong. And up. Don't let me pull them. Spread your fingers out nice and wide. Can you do this like that? Okay. Can you tap your hands on your back and forth as fast as you can? Okay, very good. I want you to touch your right shoulder with your left pointer finger. Okay, good. I want you to touch my finger with your pointer finger. Now touch your nose and do it everywhere it goes. Just testing some input to touch your nose, back to your nose, back to my finger, back to your nose. Very good. Can you do it with the other hand? Perfect. Any up like this? Any pain or tingling in the wrists when you do that? Can you get the wrists together? There you go. I'm gonna tap on here. Any pain? All right. I'm gonna feel the. Go ahead and relax for me. Relax for me. I'm just gonna feel the joints. Checking the skin here as well. Do you see you have some tattoos? They seem healed very nicely. If you ever have any redness or open wounds on these, obviously you should go get that checked out. Any pain in the fingers?
No.
Okay, no arthritis or aches, things like that. Can you flip your hands over for me? Just checking the nails. And you can go like that for me. I'm just looking for any clubbing. Can you do it with each finger? Okay, no problems there. That looks great. All right. And just relax for me. And the last thing we're going to do is just finish out the sensation on these arms. And again, same exact thing as we've been doing. So just close your eyes and say yes when you feel it.
Yes. 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 Yes.
Okay. I've got something cold here. Feel how that's cold?
Mm-hmm.
Just say cold or warm.
Cold. Warm. Cold. Cold.
Sharp or dull? Same thing as before. And just put your hands out for me like this. Just lay them on your...
Dull. Dull. Sharp. Sharp. Dull. Dull. Dull.
Right, very good. No problems with the arms. I've got this little tweezer here. I'm going to put 1 point or 2 points on your hands. So up here it's 1 point versus 2 points. Do you feel the difference?
Mm-hmm.
Okay, just say 1 or 2.
Okay. 2. 1. 2. 1. 2.
Very good. And the same thing on the other side.
2. 1. 1. 1. 2.
Wonderful. I'm going to take your hand at the knuckle. That's down. This is up.
Okay.
So close your eyes and tell me down or up.
Down. Down. Up.
Okay, same thing on the other side.
Up. Down. Down. Down.
Okay. All your neurological sensation in your arms is completely intact. No issues there, so that's wonderful. Let me just take a look at my notes here to make sure I didn't miss anything. Veronica, I think you're looking really good. There's just a couple of things I'll have monitored for next year when you come back. Keeping an eye on that cracking and clicking, making sure it's not developing any swelling or arthritis. You're still very young, obviously, so that could get a little worse as you get older. Okay. Well, I think you look great, and I appreciate you coming in today, and I hope you have a wonderful rest of your day.
Thank you.
Hi Tori, my name is Dr. B. Nice to see you today. I'm going to be doing a cranial nerve exam on you, okay?
Okay, sounds good.
So before I get started, I'm just going to ask you some general health questions. Are you in any pain today?
No.
Okay, so if I gave you a scale from 1 to 10, with 1 being no pain and 10 being excruciating pain, you would be at about
A 1.
Perfect, okay. And have you ever had any issues with your vision? Do you wear glasses or contacts?
No.
No, okay, so you can see far near sighted.
Mhm.
Okay. And what about any issues with your nose? Any smelling issues? Any issues breathing in or out?
Nope.
No? Okay. And any issues with taste in your mouth? Any pain, sores?
No.
Okay. Any issues with your hearing? Can you hear the same on one side and the other?
Yes.
Perfect. Okay. So generally, it seems like your health is good. We're just going to go through and test all of your cranial nerves and a few of your reflexes and neurological type things to make sure that everything's in order. And we'll just address anything that pops up. So any pain or discomfort along the way, just stop me and let me know, all right?
Okay. Thank you.
Let's start out just getting your blood pressure. Do you have an arm preference? Perfect.
Do you want me to roll my sleeve up?
Or you can just leave it down like that. And just Is that okay right there?
Mhm.
Okay, just stop me if you're in any discomfort. Okay, good. So you're 117 over 70. That's perfect. Thank you. Just gonna put on some gloves. Is it okay if I touch you?
Yes.
Okay, I'm just gonna go ahead and feel your head. Any lumps, bumps, pain, tenderness, anything? Does that hurt at all? No. Just check a few areas here. No redness, swelling. Okay. Now just take a look at your skin. It's nice and even. Warm to the touch and dry. Everything looks nice and symmetrical. Do you have any pain when I touch here?
No.
What about right here?
No.
Okay, perfect. I'm just checking your ears. We'll take a closer look at those in just a second. Eyebrows look good. Eyelashes are nice and distributed. Lips look even and not too dry or cracked. Okay. You go ahead and push on my hand right there. Perfect. And just move your head and back like that against my hand. And to the side. And again to the side. Okay, that's good. Cranial nerves intact there. So you can go ahead and just take a look into your eyes. I'm just going to be using a bit of a light. I just want you to look past my shoulder and just ignore me, okay?
Okay.
I'm just looking for the eyes reacting, and they do. Perfect. You take a look at this tip of my pen, just follow it everywhere it goes. Any double vision here?
Maybe a little bit.
A little bit? Okay. What if I do it right here? Is that any better?
Same thing.
Same thing, a little double. Okay.
Yeah.
Go ahead and look at the tip of the pen right here.
Okay.
Ignore my finger. And can you look at my finger? Good. And look back at the pen. Okay. Any issues there? Any straining in the eyes?
Not at the moment, no.
Okay.
Thank you.
I'm just going to take a little bit of a closer look because you did have that little bit of double vision there. And I can just look straight over my shoulder. And apologies for getting a little close here. So I would say if that double vision continues to just go see an optometrist and get a full workup, but Everything looks okay, looks intact. I can see the red blood vessels just fine. Go ahead and do a little bit of a nearsighted eye test here. So go ahead and hold this just about there. And can you read this line for me right there?
O-L-C-F.
Great. And can you cover one eye, choose whichever side you choose, and just read the same line backwards?
F-C-L-O.
And then cover the other eye. And can you read it forwards?
O-L-C-F.
Perfect. Actually, go ahead and use this, cover one of your eyes. I'm just going to test your peripheral vision. So I want you to stare straight at my nose and tell me when you see my fingers come into your view, okay?
Okay. Okay. Yes. Yes.
Perfect.
Yes.
Good.
Yes.
Okay, switch eyes for me. And look straight at my nose.
Yes. 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 Yes.
Perfect. Okay. Good. The last little eye thing we're going to do is just check for your color. Just have a little color chart here. Okay, can you tell me what this color is?
Green.
And what about this color at the top?
Red.
Okay, and this bottom color?
Yellow.
Perfect. So that's fully intact. I'm just going to take a look at your nose. You said no problems with stuffiness or dryness in your nose?
I have had quite a lot during the winter season.
Okay. Is that normal for you?
Not particularly. I feel like the weather has been really dry, but I do have really bad allergies too, so it's probably related.
Could be, yeah. Let me take a look. Just going to gently tip your head back for me. A little bit of redness and swelling for sure. Not seeing any discoloration. Not an excess of buildup or anything like that. Can you breathe in here for me? Okay, on this side. Okay, yeah, a little occluded on this side. Is it painful at all when I do that?
No.
Okay. I'm not too concerned. You can try some over-the-counter medication, some daily allergy medication. Because you do have, a little bit of redness and swelling in there, and that discomfort, if it gets worse, I would probably want to take a closer look and maybe do a scan for any sort of sinus infection or anything like that, okay? And while I have this out, just open your mouth for me real quickly. Can you say ah? Okay, good. Let me check my light. Okay, everything looks good. Can you, with your tongue, the inside of your mouth, press against my hand? Good, nice and strong. And on this side. And can you puff your cheeks out? Alright. This side now. Just going to give you something to smell. Go ahead and close your eyes for me. And cover one nostril. Can you tell me what that smells like?
Coffee?
Perfect. And cover the other side for me. And you recognize that smell at all?
It smells like garlic.
Yeah, perfect. You got them both. I'm gonna make my way to your hearing. And you said no issues hearing or anything like that? No. Okay. Just gonna check inside your ear. Move your hair for a second. And I do see a little bit of redness and swelling discharge in there as well. That could be related to the allergies, the same. Just check on this side. And same in there. Yeah, not too concerned, but there's definitely a little bit of redness. Do you ever get itchiness in your ears at all?
Yes, during allergy season.
Okay.
I do as well.
That makes sense.
Yeah.
So, any pain or tenderness when I press in there like that?
No.
And on this side, any pain or tenderness?
No.
And nothing along this part?
No.
Let's do some hearing tests. Got this
tuning fork. I'm going to hit it. I'm going to put it right in the middle of your head. Just tell me if you hear it left, right, or the same.
Okay. Right.
Okay, try one more time.
Oh, nothing. Oh, right again.
Okay, so on that side, or on that side? Okay. And I'm going to do the same thing. I'm going to hit this. I'm going to put it on the back of your ear. Tell me when you can't hear it anymore.
Okay, I can't hear it.
What about here? Can you still hear it?
Yes.
Perfect. I'm going to do the same thing on the other side. Tell me when you can't hear it anymore.
Okay, I can.
Can you hear it here?
Yes.
Perfect. Okay. So in theory, you should really hear more the center of both ears. So, but again, there's a little bit of swelling in this ear, so that can be one of the causes of that. I do think after that over-the-counter allergy medication, that would swelling would go down and the hearing would even out on both sides.
Okay.
But we'll go back into that if that doesn't change. All right. I'm going to do a little bit of neurological on your face now and on your upper body. So first thing I want to start out with is having you make a couple of faces. So can you smile for me and frown and lift your eyebrows up? Perfect, nice and even. Okay, can you close your eyes and don't let me open them? Good. Can you keep your jaw closed against my hand? Good. I want you to shrug your shoulders. Nice and strong, very good. Put your arms up like this and don't let me pull them. Good, and now don't let me push them. Okay, hands up like this, don't let me pull them back, and don't let me push them. Okay, do the same thing with just your thumbs now. Good, okay. I'm going to do some reflexes on you. We're almost done, thanks for bearing with me. Just go nice and loose for me, okay? Good. Good. Okay, on the other side. Nice and loose. Give me all your weight. Good. Okay. I'm going to do some sharp and dull sensation. So I've got this little tiny, if you put your hand out, sort of like soft. Like that, okay? And then this pin is a little bit sharper, but it's not going to pierce the skin, okay? So I'm just going to have you pull up your sleeves just a little bit and close your eyes and tell me sharp or dull.
Dull.
Good.
Sharp. Dull. Dull. Sharp. Sharp.
Yep, good.
Dull. Dull.
Good. Now I'm just going to touch your face with a real light cotton pad here. And I just want you to tell me if you feel it.
Okay.
So it's just this, okay? Tell me yes when you feel it.
Yes. 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 Yes.
Very good. Alright, I think we're nearly done. Let me just take one last general look. I'm going to go ahead and do some, there was a couple of missed things with the neurological, so go ahead and put your hands up for me. I'm going to draw a number in your hand facing you. Close your eyes and tell me what I'm drawing.
3.
Perfect. And I'm going to do one in this hand as well.
7.
Great. Now would you go ahead and put every finger like this? Good. Perfect. And can you clap your hands? And a little faster. Good. Okay. So everything was all good there. I think that you look pretty good for the day, Tori. So do you have any questions for me?
No, I don't think so.
Okay, so basically I think what I'd suggest to you is just, I think the eyes and the ears may all be related to those allergies and being a little stuffed up and your sinuses being a little bit pressured. So go ahead and
try some over-the-counter allergy medication for 60 days, and we'll have you come back and we'll do the exam again to make sure that those things have cleared up, okay?
Okay, thank you.
All right, thanks for coming in.
Of course, thank you.
Hi Luna, I'm Dr. B. Nice to meet you.
Hello, nice to meet you as well.
So it looks like we're doing a head-to-toe assessment on you today. Is that correct?
Yes, absolutely.
Perfect. Any specific concerns?
No, I just haven't had a head to toe done in a very long time, and I want to be on top of my health.
That's great. I mean, it's great to be proactive like that, and definitely good to have this done, at least every 6 months or a year to make sure. So I'm just going to run through a couple of questions for you.
Okay.
And just sort of start head to toe and ask you down. So starting with your head, how is your thinking and any problems with memory?
I haven't noticed any problems with memory, but I can get stressed out, especially at night, and I get headaches occasionally.
Headaches, okay. And where are those headaches in your head? In the front of your head or the back?
More towards the side, right
The
here.
sides? And just on that left side generally?
Mostly on the left side, yes. I also sleep on my left side, so I don't know, maybe it's because
Okay. Okay. And you always so you sleep on your side on the left side
yes, that is.
with your hands underneath your head.
With my hands, usually I make a pillow for myself with my hands.
Okay. Yeah, it definitely could be leading to some muscle tension, but we'll check it out. Moving down to your eyes, any vision issues, changes in your vision?
I do wear contacts, and I have astigmatism,
Okay.
but that has been constant over the years, so no recent changes.
No recent changes. And the contacts are the right prescription for you? They're working for you well?
Yes,
Okay. You're wearing them now.
yes.
Moving down to your nose, any issues with dryness, dripping, swelling, not able to smell?
My nose is constantly running. I think I have allergies.
Okay, let's
Seasonal
definitely
allergies.
take a look at that.
But no issues with my smell.
Okay. With your teeth, moving into your mouth, any issues with tasting?
No, none that I've noticed.
Okay. And now are you going to the dentist as well?
Every 2 months, yes.
Every 2 months?
Yes.
Wow.
I
So
love
you take
going to the
very good
dentist.
care of your teeth. And have you ever had any orthodontics, any braces or anything like that?
No.
So you have a very naturally straight smile. That's wonderful. Very lucky.
I was lucky.
Moving on to your neck, any pain or tension? You said you had those headaches. Does any occur in your neck as well?
Usually I do get tense, a tension right here,
Okay, so more in your shoulders.
mostly after I work out.
Okay. And how many times a week are you working out?
I try to do at least 3 times a week, most of the weeks.
Okay, that's great. And what are you doing? Cardio, weights?
Mostly cardio.
Cardio. Okay, so that's that running, biking.
Running, biking. I do lift some weights too from time to time, but mostly cardio.
Okay. Any issues with breathing during cardio? Any issues with your chest?
No.
What about your stomach? You're having regular bowel movements?
Yes.
And any pain or bloating, certain foods, anything like that?
No, I've not noticed anything of
Do you
that
have
sort.
any allergies to food in general?
No, no allergies to food.
Or medication?
No.
Okay, great. With your legs, anything you've noticed? Any tingling, numbness, trouble walking?
I do hear a lot of clicking when I work out and I stretch,
Okay.
especially in my right shoulder here. But that has been going on pretty much my whole life.
Does it cause you pain?
No, no pain.
So it's just a sound.
Just the sound, yeah.
And lastly, your feet. Any issues with your feet?
My calves, the muscles there hurt a lot.
Okay.
Probably from running.
Probably, but we'll check. So if there's any excessive swelling or tightness or heat down there.
Yeah, that'd be great.
Okay. All right. Well, I think I have a good assessment to start and go forward. I am going to do a thorough check head to toe just in case there's anything you have missed. It seems like you're in pretty good health, but we want to catch anything early, okay? So I'm going to take a feel in your head. So just look forward for me. And I'm just going to do a general palpation. Any pain or tenderness when I do this?
No.
Okay. Right on this side here where you have those headaches.
Yeah, right there.
Is that painful to touch?
A little bit.
A little tender?
Yes.
Does it shoot anywhere else in your head? Any radiation?
No, pretty localized.
Localized, okay. Right here.
Yes.
Anything down here?
A little bit, just a tiny bit.
Just checking through that muscle there. There's definitely some tension in that muscle.
Yeah, right there.
Your hair is very thick. Sorry if I'm pulling it all.
That's okay.
And any issues with this right side?
No, that's pretty good.
Okay. I'm going to take a look there. Just make sure there's no visual bruising or anything I can see. Just turn your head towards me slightly. Perfect. So it starts right about here.
Yeah, right there.
I don't see any bruising or swelling or redness. While I have this, I'm just going to do an overall check of the scalp. Wherever itching or flaking ahead.
During the winter time.
I'm not seeing anything right now. You're just tilting your head down for me, please. Thank you. Hair is nice and healthy and thick. Doesn't look like there's any color changing. Okay, go ahead and put your head up. Just going to take a look at split ends. I'll fix that for you. Got beautiful hair.
Thank you.
No major breakage. Are you using heat on your hair ever?
Sometimes as a straightener.
Okay. It's very thick and there's not too much breakage at the end, so I think as long as you're using some sort of hair mask or protectant after, or whatever you're doing is working fine.
Yes, I do use oil.
Okay, oh. Let's just take an overall look at your face. I didn't see any injury for that side of the head, so that's leading me to believe it's either some swelling or muscle tension, so we'll keep moving on with the exam, but I will keep an eye on that. So just look forward for me. I'm just going to look at the skin itself. Have you ever had any moles or freckles, lesions removed?
Yes, I've had a couple of moles on my body that were removed because they were not looking too good.
Okay, so you do have a history of that. And are you visiting a dermatologist?
Every 6 months, yes.
Perfect. Skin looks really clear. Just a couple of freckles on the face, but they all look small and flat. Nothing to be concerned about. Eyebrows look nice and symmetrical. Hair's even distributed. I'm going to have you make a couple of faces for me.
Sure.
Just want to check the symmetry in your face. Can you smile for me? And frown. And puff out your cheeks and don't let me push them in. Okay. And raise your eyebrows nice and fine. Good. And then close them nice and tight. Don't let me open them. Good. Strength is good there. I'm going to have you open and close your jaw for me. A little bit of clicking there. Is that normal for you?
Oh, yeah, usually.
Okay.
Unfortunately.
You said you're kind of a clicky person, right?
I click a lot, yes.
Well, everyone will hear you coming at least. Just feeling that muscle. Can you do it one more time for me? Just clench. Okay, muscle's good. Okay, and eyelashes look good as well. Any problem with hair loss there?
My eyebrows, no.
No, okay. Look into your eyes, so just look straight ahead for me. I'm just going to shine a light and just ignore it. pupils react. Shine right in the middle here and come in. Okay. Go ahead and stare at the tip of my pen. Just, is it double vision at all right here?
No.
Okay, follow it everywhere it goes, just with your eyes. Don't move your head. Any double vision with this?
No.
Any blurriness?
No.
Okay. I want you to look at the pen and then look past me at the back wall. Ignore the pen, ignore it. And then look at it. Good. Okay. And look at the pen now and just follow it in. Good. Everything reacts perfectly with that. And look a little closer into the eye. So I'm going to get a little bit close here. So apologies. Just stare straight ahead though. Okay. Same thing on the other side. All right, that looks fine. Got a little eye chart for you here, and you said that you can see fine with the contacts, right?
Yes.
So both distance and up close, right?
Yeah.
Okay. So I'm going to have you read this line here with both eyes.
EPTZO.
Great. And can you cover one eye and read it backwards for me, please?
OZTPE.
Okay, cover the other eye. And try this line down here. See that one?
CFDHJ.
Perfect. Okay, no vision problems. Just check the pupils, and you're at about a 4. There's a little bit low light in here, so that's totally normal. I'll give you this card. I want you to cover one of your eyes. You can choose which one to start with. I'm going to cover that same eye, and I'm just going to have some fingers coming into view. Keep staring at me, and just tell me when you see it. Say yes when you see it.
Yes.
Okay.
Yes. Yes. Yes.
Okay, switch eyes for me, please.
Yes. 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 Yes.
Okay, and now with both eyes, I'm going to do the same thing, but just stare at my nose and tell me which one's wiggling, left or right.
My left. Left. Both.
Mm-hmm.
Right. My left. Both.
Good, very good. Same thing, just tell me how many fingers I'm holding up.
2.
Okay,
2.
good.
1. 4 in total.
Perfect. Okay, so no problem there. And while I'm having you do some math, I'm going to ask you a couple of logic questions.
Okay.
So can you tell me what you had for breakfast this morning?
Cream cheese and a toast.
Okay. And can you tell me who the first president of the U.S. was?
George Washington.
Perfect. What was your favorite subject in school?
Mathematics.
So your short-term memory, your long-term memory, and your information gathering seems to be totally intact. If you were to find a crying baby on the street, what would you do?
I would call 911.
Okay.
Call the police.
So your decision-making seems to be intact as well. I'm going to have you add up some numbers for me. So what's 5 plus 7?
12.
Okay, and plus 7 again?
19.
Perfect. Can you spell cat for me?
C-A-T.
Okay, and what is a cat?
An animal.
Great. So all of that seems to be intact. You're thinking you're able to process that information correctly. I'm going to show you a couple of cards here, and I just want you to tell me the shape and the color. This is also going to test some color blindness here. So tell me the shape and the color.
It's a green heart.
Okay.
Purple triangle.
Very good.
Yellow star.
Excellent. Just do one more.
That is a black oval.
All right. So Luna, looks like your thinking is totally intact, your vision and your color is intact. just going to take a look into the nose and put some gloves on for that. You said no trouble smelling, but a little bit of swelling and stuffiness, right?
Yeah, all the time.
Okay. Now have you breathe in for me? Okay, a little bit of occlusion there, definitely. Let me take a look into that nose. Just tilt your head for me, please. There's a bright light. Definitely can see that swelling. The left side is worse than the right side. Head down. There's no redness though. Doesn't look like you said, it's probably allergies. Doesn't look like there's any redness or chafing in that way. I would guess it is just a little bit of that histamine reaction. I'm going to give you something to smell. So just close your eyes for me, and I'm going to give you a scent.
It smells like lavender.
Mm-hmm. Same thing here, close your eyes for me.
Coffee.
Mm-hmm. Okay. That's great. Let me just palpate really quickly. Any pain up here?
No pain.
Just a little discomfort with the swelling there. Any pain in the sinuses here?
No.
What about right here?
No.
I'm just going to feel the face. Let's check the lymph nodes while I'm here. Can you shrug your shoulders for me? Okay. I don't feel any swollen lymph nodes again. Another good sign that it's probably allergies and not illness. Just take a quick look at the ears. Any pain when I touch the ears?
No.
But on that right here.
No.
Okay. Go ahead and take a look in them. Nice and clear. They look great. Yours look really clear. So whatever congestion you're having in your nose, does that seem to be bothering your ears at all? Are you having any hearing loss, anything like that?
No.
Let's just do a couple of tests. I've got a tuning fork here. I'm going to hit it and put it on the top of your head. I want you to tell me if you hear it more left, right, or equally.
It's pretty equal.
Okay, perfect. I'm going to put it on the back of your ear here. Tell me when it goes away, when you can't hear it anymore.
No.
Can you still hear it there?
Yes.
Same thing on the other side. Can you hear that?
Yes.
Tell me when it goes away.
No.
Can you hear it up here?
Yes.
Right. So your bone conduction is a little less than the air, and that's perfect. Now, if you close your eyes, I'm going to make some soft sounds next to your ears. Tell me left, right, or both.
Right. Left. Right. Both. My right.
Mm-hmm.
My left.
Okay. Perfect. Perfect. Okay. I'm not worried about your ears or your hearing at all. They look great. So let's just take a look at the mouth, finish out the face. Can you open up and say ah for me? Okay, palate rises. I'm just going to quickly take a look at the teeth here. You said you go to the dentist often. They look great.
Yes.
And you checked out that jaw. I'm just going to give you something to taste. So I'm just going to give you a little bit of spray here. What do you taste?
That's like citrus, lemon.
Yes, perfect. So all of the senses are intact. I just want to check out your sensation now in the face. Just gonna sanitize my hands. Right, so I've got a little bit of a soft touch there. Do you feel this on your chest? Does that feel soft to you?
Yes.
Okay. Close your eyes and just say yes when you feel it.
Yes. Yes.
Does that feel the same on this side and this side?
Yeah, same sensation.
Mm-hmm. This side and this side feel the same?
Yes.
Okay.
Yes.
Feels the same. And you felt it on both sides?
Mm-hmm.
Okay. How about that? You feel
Yes.
that? Okay. I've got a slightly sharper side here. I'm going to do the same thing. Just tell me if it feels the same roughness on both sides. Does that feel as rough as that?
Yes. Yes.
And that feels the same.
Yes.
Just going to do a little puff of air. Just want to make sure you can feel that.
Yes. Yes.
That's fine. Open your eyes for me. I'm just going to do a little bit of a reflex here. Yeah, good. Good blink. Good blink. All right, lastly, I just have this, it's much sharper, so just give me your hand. It's much sharper on that side and dull on that side, right? So I want you to just close your eyes and tell me sharp or dull.
Dull.
Mm-hmm.
Sharp.
Good.
Dull. Sharp.
Mm-hmm.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull.
Okay. And does this feel cold to you?
Yes.
Cold on that side?
Yes.
Same here. And here.
Yes.
And here. And here feels the same cold?
Yes, same cold.
Okay, perfect. I'm going to move down to your neck now, Luna. So I felt a little bit of those lymph nodes before, but I'm just going to have you, can you swallow for me? Good. Swelling there. So there's some tension in your shoulders, right?
Yeah, usually.
You can feel the muscle tightness. I'll take a closer look at that on the back, but I just want to have you move your shoulders for me. Can you move them around, shrug them up for me? Can you push against my hands, resistance? Okay. And this way, turn towards me. Turn your head towards my hand.
Okay.
Let me push. There you go. And this side, don't we? Push. Push forward. Push back. Okay, good. And any tension in the neck when I did that?
A little bit, maybe. Not too much. No.
Not too much. More just the muscle tension and not like a sharp shooting pain down the spine.
No sharp shooting pain, no.
I feel the joints here. You got some. You're cracky in the elbows too, you said?
I'm clicky everywhere, yes.
No swelling though, so that's good. And the wrists. Can you make some motions for me? Can you go up and down? Can you do that against resistance? Good. Good. Up like this and down. Same thing, do it against resistance. Up and down. Oh, you're really strong. Arms all the way up. Any pain in the shoulders when you do that?
No.
Okay. And can you bring them back behind you like this?
Yes.
Okay. Any pain with that?
Maybe a little bit of a tightness, but not pain.
Okay. You can relax for me. I'm going to have you do similar things with your hands. So lift your hands up for me and down. And don't let me pull you. And lift them up. And don't let me push you. Okay. Can you go in and out with your wrists? Like this. Okay. On the side. Very good. Check your cap refill while we're here. That looks fine. Just checking the skin on your arms. You said you had a few things removed. Anything from the arms?
No, from my legs and my tummy.
Okay. these all look fine to me. There's just a little one on the inside there, but again, all flat, all around.
Oh yeah, I had one removed from somewhere here.
Okay. Looks like it's healed up pretty well, if that's the case. Their arm for me. And nice and clear on the inside. I feel some pulses here. The pulse is a little bit deep. Is that normal for you to have a little bit of a weak pulse?
Usually I get heart palpitation sometimes.
Interesting. Those aren't quite as deep, but I do want to take your blood pressure just to make sure that you've got, you know, you mentioned those sort of anxiety
Sometimes,
palpitations.
yeah. Thank you.
Do you have an arm preference?
Yeah, I can do this one.
And slip that through. Tangle up here. Go ahead and relax your arm for me, please. And just breathe normally. This one's gonna just relax. All right, and just hold that for me for just a second here. Thank you. Okay, I'm just gonna set this right here with you.
Can hold it down.
And this arm just relaxes right on the, yep. Make it a little tight there. Is that okay?
Yes.
Okay. Blood pressure is 118/72, which is really good. So that's good. I just wanted to check that.
Thank you for that.
So as far as the pulses go, I'll continue to check as we move down. Just make sure that there's circulation. But do you ever get cold hands and feet? Tingling in the hands and feet? Okay.
Yes.
So that is not surprising to me with the pulse being a little bit weaker. And that's also not an indication of a connection to if you have a faster pace heart because of anxiety or something like that. It's not necessarily going to make the blood pump better to the extremities. So things that can help with that are just making sure your vitamins are all in check. So we might want to do some blood work as well as some, yoga, making sure your body is open and circulating properly. So I'm going to do the same sensation test, but on your arms.
Okay.
So again, close your eyes and just say yes when you feel it.
Yes. 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 Yes.
Can you flip this palm over for me, please?
Yes. Yes.
Good. Same thing on this side.
Yes. 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 Yes.
And flip the hand over.
Yes. Yes. Yes.
Perfect. And side to side, does that feel the same?
The same sensation, yeah.
Same sensation side to side?
Yes.
Here and there.
Yes.
And you didn't feel any less in the fingers there?
Same sensation.
Same. Okay. So that's good. All right, let me grab the other tool here and we're going to do sharp or dull. So again, this sharp sensation here, you feel that
Yeah.
versus that?
Yes, very different.
Okay, so just tell me sharp or dull.
Sharp. Dull. Dull. Sharp.
Good.
Sharp.
Okay.
sharp, dull, dull,
Okay.
dull, sharp, sharp, sharp,
And flip the hand for me, please.
dull, sharp, dull, dull.
Very good. And just look straight ahead for me and don't pay attention to what I'm doing. Okay. As long as I have this out, same thing. Does this feel cold like that? Same
Yes.
temperature?
Same temperature.
Same temperature here?
Yes.
Same temperature there.
Yes.
I'm going to draw something in your hand. It's going to be a letter. I want you to tell me what that letter is.
A.
Okay, and now it's going to be a number.
1.
Mm-hmm. And on this side, same thing. This one's going to be a number now, too.
3.
Okay, and then a letter.
T.
Perfect. Using the hands, I'm just going to move a joint up or down. Do you feel the difference there?
Yes.
Okay. Go ahead and keep your eyes closed and just tell me up or down.
Up, down, down, up,
Very good. Same thing on the other side.
down, up, up, up.
Awesome. So proprioception's intact. I'm going to give you an object to hold. Just want you to tell me what this object is. Keep your eyes closed.
Oh.
Let's try that again.
Tricky.
No problem. I'm going to give you an object to hold. Just tell me what this object is.
It's a feather.
Perfect. It's a feather pen, but close enough. All right, you can open your eyes now. I'm going to move down to your chest. For now, I'm just going to observe the heart. So you can just breathe normally. When you have those palpitations, do you get any shortness of breath, or do you feel pounding in your chest?
I always feel the pounding, and sometimes I get shortness of breath, but not too bad.
Not too bad. And how long does that normally last?
A couple of minutes.
Okay. Right now I'm going to have you take a deep breath every time I touch you with my stethoscope, okay? Okay. Good. Okay, lungs sound clear so far. I'm going to tap here. That all sounds normal. I'm going to have you say 99.
99,
Okay, one more time.
99,
And again.
99.
Okay, take a deep breath in for me. And out. Good expansion. Let me go ahead and have a listen on the back. Would you be able to flip around for me, please?
Yes.
So again, I'm just going to have a listen. And I'll just have you take a breath every time you feel me touch you. And last one. Okay. Any pain when I hit you here?
No.
By here?
No.
Okay. Take a deep breath in. And exhale. Good expansion. Say 99.
99,
Again.
99,
One more time.
99.
Okay. I don't hear any chest issues. I think that is definitely could be an anxiety reaction for sure. Just feel the spine. Just palpating here. Any pain when I press on here?
No.
I got the muscles on the other side here.
No.
You said there was some tightness in the shoulders.
Yeah. Around my shoulder blade.
Up here.
Yes.
Okay. Yeah, I can feel actually quite a big knot right there. You feel that right there?
Yeah, right there.
Yep.
That's the spot.
But there's good symmetry to your back. The spine is straight. That feels like muscle tension. You may want to see if your insurance covers massage. Well, many of them do. I think some massage therapy could be good for those tight muscles. There's some tight muscles right here as well. Okay, can you just tip to your right side? Okay, and to your left. And curl the head forward for me. And you can come back up. And just twist, yeah, like that. Any pain there?
No.
Twist to the other side. Does that feel okay?
Yeah.
All right. So, Luna, you can go ahead and lay your legs out long. I'm going to move down to the lower half of your body now.
Okay.
Okay, Luna, now that I have you down here, I'm going to take a look at your stomach. And you said no pain or discomfort in your stomach at this time?
That's correct, yes.
Okay. I'm going to just briefly... Do you mind if I just lift this up for 1 second? I just want to take a look. Okay. Good. No bumps or swelling. I'm going to feel the stomach here a little. I'm just going to go really light. Let me know if there's any pain. Any pain with this?
No pain, no.
Okay. You go a little bit deeper. Again, just take a deep breath in and then breathe out. Any pain with deeper palpation?
No pain.
Okay. Just going to check some pulses here. Okay. And feel for a couple things here. All right, that feels normal. I'm going to have a listen. Sounds good. I'm just going to tap here. Okay. Just checking the neck here really quickly while we're laying down. That's fine. Let's move on to your legs. Just going to feel the joints. Hip joint. Knee joint. Okay. Have you make some motions for me? Can you lift this leg off the table and put it down? Can you bend your knee and pull it up to your chest? Any pain with that?
No.
Okay, put it down. Same thing on this side. Leg up and in. Okay. I'm going to make a couple motions myself. Just relax. Is that tender or painful at all on the hip?
No.
That feels okay? Yes. Okay, can you push up against my hand? Good, and down. This side. And down. And put your knees upwards, your feet on the table. Yep, just like that. And resist me. Kick out. Good, same thing here. Any tension in the knees there when I do that? Pain? No. Okay. And you put your legs back out again. And just ankles up and down against resistance. Down, down, up. push back on me. There you go. Like that. And then can you turn your foot side to side while holding that ankle there? Perfect. Okay. Did hear a little bit of cracking like you said, but nothing major. And try get your pulses really fast actually. Again, yeah, a little weaker in the toes, feet area. You said you had some coldness down here too?
Yes, all the time.
All the time, okay. I'm going to just touch you with the same cotton. You feel that over the leggings there?
Yes.
Okay. And just tell me yes when you feel it.
Yes. 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 Yes.
Okay. With the sharp or dull, are you able to feel the difference between that and that on the leggings?
Oh yes, definitely.
Okay, so tell me sharp or dull.
Sharp. Sharp. Dull. 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 Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp.
Good.
Dull.
Okay.
Sharp. 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 Dull.
Very good. I'm going to stroke the bottom of your foot here. I'm just testing for a reflex. Just relax. Okay. Okay. Check a few other reflexes just while you're down here. So just bend your leg for me just a little, just sort of like that. Perfect. Okay, good. And on the other one, very good reflexes. Good. Okay, relax. Pretty brisk there, so that's a good sign. Since you have some of that coldness down there. We'll do your knees when you're sitting up again. Well, actually, I'll just try it. Give me the full weight of your leg. There you go. Now clench your teeth on the count of 3. 1, 2, 3, clench. You feel a little funny, right? Give me the full weight of your leg. And clench your teeth. 1, 2, 3, clench. Okay. Look at your arms when you sit back up. And then, lastly, do you feel comfortable with me taking off your socks?
Yeah, of course.
Just want to check in between the toes there. No history of diabetes in the family?
No.
Just check right here. And the cap refill. Okay, that's fine. Same thing on this side. Alright, yeah, definitely feeling that coolness, the temperature in the foot there. Alright, Lena, go ahead and sit up for me. And just finish off with a couple of reflexes in the arms. Just give me the arm here and just completely relax. Give me all your weight. There you go. Good. Good. Again, relax. There you go. There. Perfect. Alright, the reflexes are all intact. They look great. Just look at my notes here, just make sure I didn't miss anything. So, everything looks fine to me. I would say just come back in about 6 months and I want to do another exam. Just make sure there's no continuation of the coldness in the hands and feet. Make sure that nothing it's not getting worse or tingling or anything like that. And then, as well as, I want you to go get your blood work done, okay? So I'll write you a script for that. Do you have any other questions for me today?
No, that's it. Thank you so much, Dr.
Okay.
B.
Thank you. Hello, I'm Dr. B.
Hi.
Can you confirm your first name for me, please?
Rachel.
Okay, great. So Rachel, I have you in here for a bit of a head-to-toe check. Is that correct?
Yes.
Perfect. So before we get started, anything that's bothering you right now?
No.
Okay. And on a scale from 1 to 10, 1 being no pain at all, and 10 being the most excruciating pain you've ever experienced, are you in any pain right now?
No. 1.
Perfect. So I'm going to basically go head to toe, and I'm going to just run through all of your functions and your vitals and make sure everything's working properly. You should do this about once a year, just to make sure there's nothing major wrong. Starting up at your head, just to make sure any headaches or dizziness, fatigue.
No.
Okay. How many hours a night are you sleeping generally?
About 7.
Okay. And is that enough for you? Do you feel well rested?
Yeah.
Okay, good. And moving down to your vision, any blurriness, double vision, changes in your ability to see?
No.
Okay, do you wear any glasses or contacts?
I do.
Okay, and you have them in now?
Yes.
Okay, perfect. And that prescription is working for you?
Yes.
Wonderful. Well, we will double check that. But, any issues with your sinuses, pain, swelling?
No.
Okay. And no changes in your smell either? Okay, and with your mouth, I can't see any major sores on the outside, but any issues with taste or pain in the mouth, teeth, that kind of thing?
No.
And any issues with your heart feeling fluttering or too fast, too slow, anything like that?
No.
And what about your breathing?
Breathing's good.
Good. No history of asthma or anything like that? Stomach, any issues currently with your stomach, food sensitivities?
Gluten-free.
Gluten-free. And is that diet working effectively for you? Okay. And what about changes in your strength in your arms and legs, anything like that?
No.
Okay. And any tingling or cold hands and feet that just is uncomfortable for you?
No.
So you seem pretty healthy, but we'll go ahead and do a full check. Just gonna give my hands a wash here. May I touch you?
Yes.
Okay. I'm just going to start out. Just look straight ahead for me. I'm just going to palpate the head. Any pain or tenderness here?
No.
What back here? Okay. Just going to look through here for any obvious signs. Here looks healthy. Doesn't seem to be any bruising or swelling. You said you're not getting headaches, right?
Right.
Good. Just check this side. Hair is really healthy. It does look like there's some color in there, but there's really not any brittleness, no hair loss that I can see. Put your head down for me, please. Looks great. While I have this, I'm just going to take a look at the face. Close your eyes for me. Sort of open your eyes. And the skin looks nice and even. Just going to check for temperature. Consistent temperature. I'll take the temperature here. It's going to go on your forehead and behind your ear, okay? Okay, 97.9. And 98.3, so that's perfect. Can you stick out your finger for me? Put this here and just relax it on there. I'm also going to take your blood pressure. So that's 99% oxygen and 72 resting heart. an arm preference?
The same thing.
Okay. So I'm actually just going to have you turn your arm and put this right on your wrist here. And just press it right there. It's going to get a little tight, okay? Good. Good heart rate, and the blood pressure is normal. Let's take a look at your eyes. First, just your eyebrows are nice and symmetrical, as well as the eyelashes. Can you look up for me, please? And look down. And look straight ahead. I'm just going to shine this light in your eye, and it's going to be a little bright. I do apologize. Okay, great. I'm just going to shine right in the middle there. Perfect. I want you to, can you see my pen right here? And is it clear for you? Any double vision?
No.
Okay. I'm going to move it in a couple of different directions, and I want you to just follow the pen. Don't move your head. Just use your eyes. I want you to tell me if there's any double vision or if you lose sight of the pen at all. Any issues there?
No.
Okay. So look way out at that wall behind me. Ignore my pen. And now look at the pen. Okay, and follow it now. Good. Good constriction. Check the pupils. And it looks great. I'm going to look a little closer at the eye, and it's going to involve me getting quite close. So again, just stare right off into space there. I'm just going to get really close. Okay, same thing on this side. Back of the eye is clear. See the red reflex. You said your prescription feels right for your eye, right?
Yes.
All right, so hold this about 14 inches away from your face, and I want you to go ahead and read that very last line for me.
LTFPH.
Very good. Cover one of your eyes with this. You can choose whichever one. And do the same thing backwards for me, please.
HPFTL.
Okay, and switch eyes for me. And forwards once again.
LTFPH.
Very good. I'm gonna have you hold on to that card. Cover one of your eyes again. Okay, great. I'm gonna stand right here in front of you, and I want you to stare at my nose. I want you to tell me when you see my fingers wiggling.
No.
Perfect.
No.
Okay.
No.
Very good.
No. No.
Okay, and switch eyes for me, please.
No. 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 No.
Very good. And without those, I'm going to have you again straight at my nose. I'm going to hold up a couple of fingers, and I want you to say right or left or both for which ones are moving.
Okay. Left. Both. Right.
Okay, and how many fingers do I have up on this side? And what about on this side?
3.
Very good. Peripheral vision looks great. Got some colors here. I want to test your ability to differentiate colors. So, what color about would you say that is?
Like a reddish brown.
And then what about this color?
Lime green.
Very good, very specific. And what about this color?
Blue.
Okay. And one more.
Pinkish red.
Very good. So even though these are relatively close in tone, you're able to differentiate, so that's great. on some gloves. I'm going to take a look. I'm going to touch the top of the eyes quickly, and then I'm going to move down to the nose. So again, I'm just going to gently press right here. Any pain there?
No.
What about in the tear ducts?
No.
Anything when I press down here?
No.
Here.
No.
Take a look at the nose now. As you see, you have several piercings. Any discharge or redness?
No.
Okay. So I'm going to look inside, so I'll have you tilt your head back just a little. Okay. Looks clear to me, and the piercing on the side. Okay. Look nice and healthy and healed. How long have you had those?
About 4 months.
Okay, so they actually look pretty healed for only 4 months. I'll have you cover one side of your nose and breathe in for me. Okay, seems clear. Do the other side for me. So you have good patency. Let's go ahead and test some of your smell. I've got 2 fragrances here, and I'm not going to show you what they are, and I want you to just take a smell and tell me what you think you smell.
It's like a orangey smell.
Yep, it's a lemon citrus, so that's just about right. And same thing over here. You did
Mint.
Yes, peppermint, wonderful. So that sense is intact. I'm gonna take a look inside the mouth, and you said no issues with taste, correct?
No issues.
Okay. Say ah for me. Okay. Okay, you can close your mouth now. I want you to clench your teeth. One more time. Okay. Open and close your jaw. A little bit of clicking there. Is that normal for you?
Hello.
Okay. Any pain when that happens?
No.
Okay. You push against my hand with your jaw. Very good. And push against me here. And pull back. And turn into my hand on this side. Okay, strength is good. Rest your shoulders. All right. I'm gonna have you make some faces for me. So that's a nice smile. Lift your eyebrows up and close your eyes nice and tight. Don't let me open them. Can you puff out your cheeks? And don't let me close them. Can you push your tongue strength into this hand? Very good, very strong. In this hand. Okay. Just gonna get some basic symmetry of the face measurements wise. And then we'll move down to the neck. So we'll just keep those in the file. We can test for swelling or any changes in that over time. And move down to your neck now. If you mind, just move your hair out of the way. Is that okay? Yeah. First thing I'm gonna do is just feel for your lymph nodes. Let me know if you have any pain or tenderness here. Any of that bother you?
No.
Shrug your shoulders for me. I'm just gonna get it right here. Okay, and relax. Okay. Can you come around here? I want you to swallow for me. Do you need a cup of water?
Sure.
Okay. All right, so here's a cup of water, and I'm just gonna have you take a sip and hold it in your mouth. Okay, and swallow for me. Very good. Okay. All right. And I just want to look at the veins here. No pulsations. Just one at a time. Listen to some of your pulses later, but I want to quickly check your ears. You do also have some piercings in here, and looks like these are nice and healthy as well. Just check the back. There's no bubbling or redness. It's really good. Any pain when I press on the ear?
No.
What about right here in the middle?
No.
And same thing on this side. Any pain?
No.
That's okay. Let's take a closer look in here. It looks fine, but I do want to test some of your hearing now. So I'm going to hit this tuning fork. I'm going to place it right in the middle of your head. I want you to tell me if you hear it more right, left, or equally.
Pretty equal.
Very good. And then tell me when you can't hear that anymore.
No.
Can you still hear it here?
A little.
Okay, perfect. As long as it's a little bit, the bone conduction should be a little less than the air conduction. Same thing, tell me when it goes away.
No.
Can you still hear that there? Okay, wonderful. Got just a little puff of air here, and I'm going to put it on your right side, your left side, and tell me which one you hear it on. So again, close your eyes for me.
Right. Right. Left. Left. Right. Left.
Okay. I'm going to whisper something in your ear, and I want you to just repeat it back to me. ASMR.
Hazel.
Try that one again. Dog.
Dog.
Okay. Same thing on the other side.
Cat.
Okay. Very good. Yeah, that first word was a little complicated. It's okay. You're able to hear just fine, and we've had this conversation as well, so I'm not worried about your hearing. While we're up here, let's test some of the sensation in the face. Just looking for my, what do you do with this? So I have a bit of a, if you give me your hand, a little bit of a soft, and then a little bit rougher. It's not sharp, but it is rougher, okay? I want you to tell me what you feel in your face, either soft like this or rough like that. You feel a difference?
Yeah.
Okay, so close your eyes and just say sharp or dull.
Dull. Sharp. Sharp. Sharp.
Good.
Dull. 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 Sharp.
Okay, and does this feel the same as that?
Yeah.
That's the same?
Yes.
Just like that?
Yeah.
Okay. I've got a bit of cool metal here. This tuning fork is quite cool. Feel that? Does that feel cold here and here?
Yes.
And is it the same cold?
Yes.
Okay.
Yes. Yes.
Okay. While I have this, I'm going to hit this. It's going to make a little bit of a buzzing sensation. So if I do this, and that's buzzing, and that's just pressure, okay? So you feel the difference between vibration and pressure?
Yeah.
All right, close your eyes, and again, try and really feel the pressure and vibration and ignore the sound.
Okay. Vibration. Pressure. Vibration. Pressure. Vibration.
Good.
Pressure.
Okay. Alright, so just relax and breathe normally. I'm just going to have a listen here. now I'm actually going to have you breathe a little deeper when I press you here. I'm going to just be taking a look at the lungs. Is that all right? Or taking a listen to the lungs, rather. And I'll lay you down to do your heart. Nice big breath. One more. Okay, I'm just going to go underneath here. Just like that. Okay, and last one. Okay. I'm going to do some tapping right here. Is that all right? Okay. Okay, that all sounds the same. I'm going to place my hands in 2 spots, here and here. I want you to say 99 for me.
99.
Okay.
99.
Okay, good. I will have you just swing your legs around for me. I'm going to take a look at the back now, okay? I'm going to move your hair just out of the way here. And same thing, I'm going to listen to the lungs. So just take, it doesn't have to be super deep, but a little bit deeper than normal breath when I touch you. Okay, and relax. And a couple more times for me. And last one. Very good. I'm going to tap one more time on the back here. Okay, and say 99 when you feel my hands.
99. 99.
Okay, can you take one deep breath in for me? Good, good lung expansion. While I'm back here, I'm going to be feeling the spine. Any issues with scoliosis?
A little.
Yeah, okay. Definitely do feel a little bit curved. Can you tilt your head down for me? Like you're going to take a dive into a pool. Sort of go forward and then come up slowly, one vertebrae at a time. Yep. Just a slight curve right there. Okay. Any pain when I hit you like that in the kidneys? Like that?
No.
Okay. Do some range of motion. Can you just twist side to side? Yep, very good. And tilt down like this. Okay, and the other way. Okay, can you tilt your head all the way back as far as it'll go? Okay, and all the way forward as far as it'll go. And can you turn it side to side for me? Just checking the neck as you do that. And that's a good range of motion. I'm going to have you lay down on your back, top side up, and I'm going to do some sensation in the arms and check your heart as well. Alright, I'm just going to listen to the heart here. And just breathe normally for me. And are you doing aerobic exercise at least a couple of times a week, walking or something?
Yeah.
Okay, perfect. Okay, everything sounds fine. As long as I have this, I'm just going to listen to the stomach here. And how long have you been on that gluten-free diet?
About a year.
Okay. Everything sounds fine. I'm just going to tap really lightly here. Any pain when I do this under here? Out this side? Okay. I want to test the sensation of your arms now with you laying down. And it's going to be very similar, where first I want you to tell me if you feel it at all. So just say yes when you feel it and close your eyes for me. It's that light touch again.
Yes. 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 Yes.
Good.
Yes. 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 Yes.
Okay, and now I'm going to do the sharp dull. So again, this is a little bit rougher than this. Feel the difference?
Yeah.
Okay, say sharp or dull.
Sharp. Sharp. Dull. Sharp.
Good.
Dull. Sharp. Sharp. Sharp.
Right. this cold?
Yes.
Okay. Do you feel the difference between that temperature and this temperature?
Yeah.
Okay, can you just say cold or warm?
Cold. Warm. Cold. Warm. Cold.
Good. It's okay.
Warm. Cold.
Okay, same thing on this side.
Cold. Warm. Warm. Cold.
Okay, I'm gonna hit this. It's gonna make a little buzzing. Say vibration or pressure.
Okay. Vibration. Pressure. Vibration. Vibration.
Good.
Vibration. Pressure.
Okay.
Vibration. Pressure.
Good.
Vibration. Vibration.
Good. I'm gonna touch you on part of your body. I want you to say left, right, or both.
Left. Right.
Okay. And I'm gonna touch you, and I want you to tell me what part of your arms I'm touching.
Hand.
What side?
Not right hand.
Okay.
Left arm.
Okay.
Right arm.
So you can differentiate where you are in time and space as well as what's interacting with you, which is great. We'll do a few more neuro tests when you sit up. For now, can you raise both arms over your head? Okay, and back down. And can you go like this? And resist me, push me away. Okay, and pull me towards you. And just, keep your hands turned this way. Perfect, and pull me towards you. And same thing with the wrist. Can you push me down? And pull back, your fingers back towards me. Very good. Okay, you can relax. And I just want to move down to the legs to do some strength testing as well. So first, can you just lift this leg up off the table and down? Okay, and can you do it against my hand? Very good, and pull me down. And knee up towards the chest. Yeah, very good. Let me just move for you. Any pain in the knee joint there?
Mm-hmm.
Okay, push me away and pull me towards you. Foot up. There you go. And push down. Okay, relax. Same thing on this side. Up and down for me. And can you push me and pull? Good. And knee up and back. Just checking the joint of the knee here. Okay, and push out for me. And pull in. And with the foot, in and out. Okay. Really good strength testing. You do have the jeans on, so I'm just gonna roll up just a little. Test the sensation. You said no coldness or tingling in the feet, right?
No.
Okay. You feel that on that side?
Yes.
And that there? Okay, what does this feel like?
Sure.
Okay, what about this?
Oh. Sure.
Okay. And I've got a little bit of a sharp tool here. I'm just going to use the back of this. I'm just going to run it down the leg and tell me if there's any loss of sensation or if it feels the same all the way down. Does that feel the same? Okay. That feels okay. All right, well, I have you do your reflexes, so I'm just going to turn you here. I'll move your sweater. And just sort of relax your leg, but turn it to the side. So like that, exactly. And just go completely loose if you can. Okay. Good. And the same thing on your knees, so just completely relax. Just give me all the weight, just relax. There we go. There we go. Perfect. Same thing on this side. And this one can go out straight. There we go. And give me all of your weight. Just relax fully. There we go. Perfect. I'll have you sit up to just complete a few neurological things, okay? So you just swing your legs around. All right, now that I have you sitting up, I want you to do a couple of motions for me. So I want you to touch all your fingers in a row. Can you go as fast as you can? Okay. Touch your nose with your pointed finger and touch my finger. And back to your nose and back to my finger. Keep going. And can you switch hands? Very good. Can you on your leg as fast as you can? Perfect. And take this heel and run it down this shin. Okay, and on the other side. Very good. I'm gonna ask you a couple of questions I want you to answer. Can you tell me who the first president of the United States was?
George
Washington.
Okay, and what is the weather like today?
Sun.
Okay, so you've got long-term memory, short-term memory intact there. I'm going to have you do some math for me. So if you have 100 and you take 7 away, what do you have?
93.
Okay, and take 4 away from that.
89.
Perfect, very good. Yeah, I know we don't have to do math in our heads too often, so it's good to keep practicing. I'm going to draw a couple of numbers in your hand. So you can just give me this one and close your eyes, and I want you to tell me what number I'm drawing.
1.
All right, and how about on this side?
6.
Very good, and add those together.
7.
Okay, all right. So I'm going to move your finger up or down. You feel the difference?
Yeah.
Okay, close your eyes and just tell me up or down.
Up, down, down, up,
Okay, same thing on this side.
down, 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 up.
All right, wonderful. You can sense that just fine. Stare straight ahead. Don't pay attention to me at all. Okay, keep looking there. Don't look at me. I'm going to tap here. Same thing, just focus. Okay, let your jaw hang for me. Good. I'm going to do the reflexes in your arm, so just completely relax my hand here. Very brisk reflexes, which is good. Okay. There you go. And we'll do the same thing over here. And just relax fully. There you go. Okay. So all your reflexes are intact. A little brisk on that left side, but nothing concerning. Just something to watch. If it gets worse, we can do other testing, but there's no other indication that you'd have any sort of neurological issue. I'll check my notes to see if I missed anything, but I think you're in pretty good shape. All right, Rachel, well, it looks like all of your main functions are intact today. Do you have any questions about anything we went over?
No.
Okay. I would say just come back again in a year for another checkup. But you look really great and really healthy. I'm glad that gluten-free diet is working for you. Don't change anything. If you start experiencing any other issues in the stomach, we can do some other exclusionary dietary tests there.
Thank you.
Thank you.